Well, so the screen sharing is on, and I hope all the participants online and offline are able to see the slides. Um, well, so this morning we are going to look into the intrapartum aspect of a positive childbirth experience. Okay, yesterday you saw the antenatal. Today we will see the intrapartum. Okay, and I want to stay at the start. My slide is not rolling. Slide is not rolling. What do you do? Okay. So, labor and birth, these are not summative events, okay? They are vital formative events. What do we mean by that? When we say summation, something is towards the end. Would you put your mics on mute, please? All those who are online. I can hear some of you speaking. Okay, so the silence, if it's there, when we ask questions, don't have silence, okay? But when you are listening to something, please. So summative events would mean events that happen at the end of a process, okay? So labor and birth, it just doesn't finish because the baby is born. They are vital formative events. What do I mean by saying vital formative events? The baby has been formed, and the baby is coming out into this world for the first time. And the way it emerges out is the most important period for that mom and for that baby. Okay, baby has to cross a very narrow passage. Baby has to cross hours of experiencing uterine contractions. Okay, baby has to stay up with circulation. Mama has to stay up with her connection with her baby. There's a lot of psychosomatic connection, lot of mind-body connection happening between the mama and the baby when this whole process is going on, right? And if the baby comes out well, wonderful. Thank God for that. Okay, everything happens good. But what if there's a prolonged labor? What if there are unnecessary interventions? What if baby gets asphyxiated? What if baby gets tight molding and tentorial tears? That beginning is not safe. You will get a live baby, okay? But the developmental milestones of that baby may be hampered. And that you and me or the team of doctors or anybody does not take notice because the mama doesn't come back. She faces her life all alone. With whatever is happening in her life, she faces that baby and the challenges that happened because of what the birth environment was. She faces it alone. That is why we say that they are vital formative events. Nothing ends there. A lot of things begin there. Okay, so labor and birth is a very grand beginning, and we are there to give that wonderful start to every baby, every mama baby dyad, and every family. Do you trust that? Yes. Okay. And you should feel the blessedness. Ours are the blessed hands to touch that baby the first time the baby sneak peeks into the world. Yes. The first hands to feel that baby. The first hands to feel the hair, to give a soft touch, to cuddle that baby. And we are in that blessed position as midwives and nurse midwives. Okay, so I'm not going to read this. You are going to read it, okay? Take a moment and gently go through every line of this testimony of a mama. Just read it. Read it what is on your screen. I don't have to read it for you. It's clear and loud. Okay. Yeah, so this is an experience of a mama. Okay, she is a very good writer and a journalist. And then she says that the miracle of life, as they call it, it is a miracle. And what was it for her? Those were the closest moments with God, she says. She terms that as very pure and moments of sanctity. Right? Okay. For a mama, it is such a holy occasion. For her, it is so honest. They are the most incorruptible moments of her life. The purity of the birth-giving process, okay, has come to fruitfulness. She sees her baby, and however her baby may look like. It is her baby. It is the baby of her dreams. Yes, okay. So this is the mother's whisper, and you and me are taking care of such kind of a mother. Okay. Are we settled? Is something on? Okay. Yeah. Yeah. So a positive birth experience. Can we have this discussion outside if it is possible? Okay. A positive birth experience is a human right of every woman. Okay. So every woman may have a normal birth experience, or she may have a cesarean birth experience. That is okay, right? 80% women do go in for spontaneous vaginal births, okay? But 20% women may suffer complications, yeah? May need care of the specialized team, the obstetricians, the surgeons, the anesthetists, right? Okay, but that's fine as long as she is taken care with safe care, right? Okay, so what we are here is not only that mothers who birth vaginally have a beautiful birth, but even mamas who go ahead and have a C-section should feel the satisfaction of a safe quality care that they have received during birth, right? Okay, fine. And you see the other side of the picture. You see how that mama is exposed. Yeah, there is a male there. All the women are looking only at the tummy. There is nobody looking at that mother's face. Nobody seeing what she feels like, how embarrassed she must be lying open like that in front of a male. Yeah, and you see the lady in the door. Do you see her? Yeah, she's hiding there behind, and her eyes are like stark open. She is dazed. She's just worried, or she is kind of confused, right? Another mama sitting down here, you see her baby is lying one side, she's on another side, okay? And there is so much depression on her face, okay? Things have not gone right with her. Life is not so good for her, okay? So mamas and babies, you see another mama here, that's the mama of our Nampally hospital. She's so happy, right? She's sitting there with her baby and so confident. You see confidence on her face. No matter if they're poor, doesn't matter if the resources are limited, but they are happy because they're taking home a very good birth experience. So what are the core facts? You know, currently, this is very striking that 22 million nurses and 2 million midwives globally deliver 80% of all health in low resource settings. So to 22 million nurses and 2 million midwives, we are catering to how many? 80% of all healthcare services. Do you feel proud? Do you feel proud? Yes, we have a lot and we need more. Why are you and me here in this hall today? Why have we taken such a wonderful topic? Yeah, that's because our hands are needed. We need help. We need people to be around us to help us to take this whole project of having our country have good maternity care, quality care, safe care, woman-centered care, and the whole world is gonna need 9 million more nurses and midwives by 2030. How many more? 9 million more by 2030. We are in 23 already. Yes, okay, 7 more years and there is 9 million nurses needed. So when you are graduating, may I have silence? If there is anything happening, I am not able to go ahead. Is there something happening? Can we finish that activity? Shall we finish it? And then I will start. No, I want everybody to be comfortable because too much of movement in front of my eyes would. This is something very serious because we're talking about life. So can we do the signatures later? Is it possible? Okay. Yeah, fine. Thank you. So we are so much more needed, so much more in number. So don't worry if I think of obstetrics and gynecology, MSc, because there is no midwifery MSc as yet. I hope it will come. Okay. Or if I think of an NPM program and a midwifery educator program, do I have a future? You have a bright future. We need so many more. We need so many more, right? Okay. Babies are going to keep coming. Life is on. Okay. And the nations which are underdeveloped, our nation, which is a developing nation, is going to need so much more help. How many of you have gone through the Lancet studies? Apart from the NPM students, anybody from the basic BSc nursing group has gone through the Lancet series? Okay, so Lancet series way back in 2014 and then continued into 2016 have brought up landmark observations of the world related to maternity health care. Who all are providing care? What is their qualification? And how do they give safe care? How are nations managing to bring about maternal health care? And that is where they came up with the fact that midwifery is so much needed. Okay, we have doctors, but they are not enough. Okay, we have people, but they are not ready to go where it is needed. Yes, and we need more nurses. We need more nurses who are qualified and educated to take up work for maternity health care and newborn care. So the current scenario, India has 27 million annual births, but about one in every fifth birth worldwide. Okay, we are contributing a lot to births. So 34% deficit in fulfillment of required numbers of obstetricians and pediatricians across the country. We don't have even enough obstetricians and pediatricians to care for our mamas and babies. There is a rise in C-section rate. You can imagine 8.2 to 17.2 in the last decade. In the last 10 years, the C-section rates have gone higher. There is rise in complications and morbidities, and there is undeniable need for equitable, safe, and quality woman-centered care. So we need a lot of hands together. You and I can contribute to it. If we are people with head, heart, and hands, okay, a very good knowledgeable head, skillful hands, and very good heart, we are needed. So the need of the hour is to curb unnecessary hospitalizations, limit the overburdening of high-level facilities, align primary and hospital care, and reduce travel time. Now, what do I mean by this? See, the more people who get professionally trained as practitioners, we are going to man the centers around the PHCs, the CHCs, the sub-centers, okay? Our presence over there who are qualified, who are prepared for normality, as well as identification of high risk, our presence there, our work there is going to help our population to bring down unnecessary hospitalizations. It will reduce their travel time because we will be available there. Otherwise, you know, people travel from so far to come to referral hospitals. People travel so far to get to one sub-center or one PHC, right? Okay. And so we are going to help lessen the burden of higher level facilities, okay? Also prevent loss of economic productivity for the patients, for our mothers, for our babies and families, okay? What I mean by loss of economic productivity, they have to spend on healthcare. If they don't reach healthcare and they get worse, they spend in private hospitals, they spend on surgeries, they spend on so many different medications. And ultimately, when a weak baby is born, okay, they spend the rest of their life on managing that weak baby. Yes, okay, there's such economic burden on that family just because things did not go right with that mother's pregnancy and childbirth. Okay, so we have to cut cost inflation across the healthcare system. Yeah, if we are able to do work for our people, we are not asked to go abroad and work for someone else. We work for our people. Our people, our country needs us. I'm not against people going abroad and working. Of course not. Okay. Of course, you go work, make a life, but you know that your own country needs you, needs your talent, needs your heart, needs your knowledge, needs your hands. Okay. So I would like to put it all summarized in this diagram where you see that it's a vicious cycle. One wheel rotated turns the other. Okay. So maternal health will affect newborn health will affect the family health, and that in turn will turn around the wheel of social impact, right? Okay, it's very easy for us to call somebody stupid, very easy for us to say, "Itna nahi aata kya? Itna samajhta nahi kya? Are nahi hai usko utni buddhi." Okay, something went wrong. Something went wrong during that birth. The developmental milestones delayed. Okay, something just didn't go well with that child and that family, right? Okay, so we as citizens are responsible. Okay, we have a responsibility, you and me as professionals in healthcare, that we bring out such childbirth experience for mamas which are safe, so that their babies are born healthy, so that babies are breastfed, their babies grow intelligent, their psychology is secure, and the youngsters that come into our country are vibrant, are productive, and thereby supporting our country with great economic benefit, right? Okay, so it starts with a drop. It starts with one experience, one family, one mama, one birth, one baby. Yes, so we got to work towards this. So this is a very interesting thing. Now I'm going to sneak a bit into my specialty, because I want to introduce you to who midwives are. You're all wonderful nursing students, okay? So just to let you know how more you can develop yourself in case you like this subject. If you feel called for maternal and newborn care, you should know what's up in the world for you. So WHO says, it is not just anybody. The World Health Organization states that when midwives are educated to international standards, okay, now when you say international standards, don't get scared. The NPM program which we have in our country is designed by the WHO, by the ICM together. ICM is International Confederation of Midwives, right? So we have that curriculum which is up to international standards, right? So that is why we are insisting that people who are wanting to have their career in maternal and newborn care should qualify themselves a little above than just being nurses. You could become practitioners. That's how we have the nurse practitioner in midwifery program, okay, which is an 18 months program beyond and above your GNM or your basic BSc, right? So if you are qualified to international standards and educated, then you can avert or you can prevent how many deaths? What's the figure there? 80%. Is that what? Is that yes. Yeah, so it's a lot. If you as nurses go ahead and pitch it into these courses and get yourself educated and your hands fine with skills and are competent to global standards, we all together can avert or prevent 80% of maternal loss, neonatal deaths, and stillbirths. So who is a nurse midwifery practitioner? I'm just deviating a bit because I need to introduce you to what I'm talking about, okay? She's a trained nurse midwife with 2 years maternity experience, and she takes additional specialized training of 18 months, passes a certification exam, is licensed and regulated by the INC, okay? And she is trained to be a professional midwife, a practitioner, that's a practicing midwife, by which standards? Global standards of practice. So the Lancet, I was talking to you about the Lancet study. Okay, so the Lancet series, it's a big series. You just type in Google Lancet series on midwifery, and it's wonderful information about all the countries, the high income and the low income countries. What is happening about maternal and newborn care, and what is the answer? Okay, so the Lancet series have come up with an answer that midwives can provide 80% of sexual, reproductive, and maternal health services. How much percentage of service? 80%, right? The rest of it, the 13% is left to our other peers, our other multidisciplinary partners. 80% of care we can give with the qualification we would have, with the education we would have for low risk and identification of high risk, we can cater to 80% of reproductive and maternal health services. So what is the solution to our rising MMRs, our rising NMRs? What is the solution? Midwifery. Midwifery practice is a vital solution. That's how you have it in your curriculum. That's why you do it so rigorously. That's why you have a case book where we want you to actually get exposed to what it is to aid a mama or support a mama in her childbirth. And over and above, in NPM program, we teach you to be practitioners, because there you are making decisions. You are not just caring as per doctor's orders. You are making decisions. You are making a plan. You are an advocate. You are communicating with the multidisciplinary team, the family, and arranging the recommendations that you feel are necessary along with the team's consideration. Okay, it's a big job and it's an independent job that you can do, right? Okay, so what is that model that we follow? It's a low-tech, high-caring model. Right? Okay. So a low technology model, we don't have too many gadgets and instruments that we need because we know that we support physiology. Okay. We support the human physiology. Childbearing is not a disease. It's normal physiology, right? Okay. How many times can it deviate? How many percentage can it deviate? Only 20% times, right? 80% is normality. How much is normality? 80%. Only 20% it may deviate. And we are trained to diagnose those deviations and give the mama, escalate that mama for appropriate care. Okay, so that's why we cater not only to low risk, but also vulnerable and high risk mamas. So our model is a low tech model, high caring model, high certainty and evidence-based model. Okay, and I think we're proud of that. We're really proud of that. Okay, so now before India, before us as a group, before SCB Medical College Hospital starts seeing this low-tech, high-caring model in full bloom, okay, let us define the quality of care. We feel that, oh, we should know what quality of care actually means. Yeah, okay. My answer to that is no. No. It is not us. Let every woman define what is quality. Okay? What is it that woman feels is quality? Not what we feel is quality. Mama lying on the table, 3-4 healthcare providers coming, one checking her head, one hand on her tummy, one somebody's hand in between her legs. Okay? Yeah, somebody checking her blood pressure. And is that quality because 4 care providers are around her? No. If you ask that mama, what is quality? She will say, leave me alone. Take my permission before you touch me. Yes, okay. So it is not for us to define quality. Let mamas define quality for us. And quality care is specific. It is even culture specific. You know, I'm so blessed to be coming to Odisha. I am blessed to see your culture, you know, and actually how well knitted everybody is. Whether you're highly qualified and professional or you're the poorest person that I see in the hospital, your culture is so strong, so strong. You can manage everything with that. I really wonder. I wonder about my colleagues, my friends. Their families are so tight-knitted. Their cultures are so strong. Their demands are so huge, even about our trainees and what I see in the hospital here, right? Okay. So when we are so culture specific, let our quality be culture specific. Yes. Okay. For that, don't go international. Yeah. Be very local with your quality. What quality care means to our mothers? How should we treat them? How shy they are? How disempowered they are, how uneducated they are, right? Okay, and what do they want? That is, if you're able to answer that question, we get the definition of quality for them, right? Okay, we have mothers here who will not even look up to you. We are ladies, we're not even men. They don't even look up to you. Yes, okay, they are scared of making any statement about themselves. If you tell them you're so sick and you need further care or something, they want to ask their husbands and come back to the OP. Yes, okay. So that is something really distressing. So those women are the ones we should listen to every day to be able to define quality. All of us agree? Yes, okay. So there can be theoretical definitions of quality, but practically our women in our care should define quality. Right? And we should follow that. Okay, so what do birthing women want? Okay, this is very interesting. Everybody wants personal achievement and control. There is no woman who likes to be treated like a doormat. No woman, whether she's rich or whether she's poor, for that matter, no human being. We all have self-esteem. We all are self-protective. right? Okay, we all have dignity. So none of us want to be treated, you know, as people without a meaning or a purpose. So we need to be active in decision making. My body, my decision. My baby, my decision. My birth process, my decision. Right? Okay. So every woman would want a healthy baby. She wants clinically and psychologically safe environment. This was a huge study done. It's a very latest study, okay, as latest as 2018. And then there it says that what do women want? So these are the themes that came up from that study. And this is global. This is not Odisha. This is not Telangana. This is not India. This is global. Globally, because even in European countries, in the West, there is abuse. Okay, there's obstetric violence. There is disrespect. Right? Okay. So those women say, as much as we want a baby, we want clinically, psychologically safe environment. We don't feel that we don't have a say. Right? We don't want to be pulled into situations against our will. So practical and emotional support, competent, reassuring, kind clinical staff. You can imagine that specified in that study. They want kind staff, people who will approach them, people who they know, saying, I'm so and so, good morning, how do you do? Right? I'm here for you if you need me. Right? If they cry, to tell them that when you're ready, you can talk to me. I'm here to listen. We may not be able to advise always. We may not be able to counsel always, but listen. At least hold their hand and listen what they have to say, right? Okay. So a physiological labor and birth is what women want. They don't want medicalization. They want humanization of birth. Yeah. Do you catch these words? Yes. Women do not want medicalization. They want humanization of birth. Humanize my birth. Treat me like a human. Treat me with care. Treat me kindly. Treat me with dignity and respect. Yesterday, you saw that lovely video like ding, ding, ding all the time. Do you remember that? Yes? It was a lovely video by WRA, right? So remember those things. They're very catchy. Now I want to take you to something very nice. Okay? I hope you enjoy that. I have videos to share. They're in another folder. I need to play them. So listen to these mamas, okay? And there are two contrast situations. One is from the government and one is from my Fernandez Hospital, which is a very posh private hospital, okay? But listen to what those mamas have to say. Two different aspects of society and what they have to say. Yeah, government. Geo. Volume. You have to connect that. Should I remove my mic? I know. I will copy that, right? We can copy it, right? Where should I copy it? Recording. Where do I copy it? Okay, just copy that. Here. Paste. What's that?
No, no, no. Sound full दिया है.
It was coming, right? Zoom का volume देखो. Okay. I think we can see it in the end. That's fine. And maybe I can play it on my laptop and hold the mic there. So after, you can.
VLC media player play करो. Open with VLC media player. Open with VLC media. पहले तो
Water bottle है नीचे.
Let us continue the topic, then thereafter.
जॉइन होने के लिए म्यूट रे जो मेरे ऑडियो रे सब सुना
Mamas, how well they feel care. And even when they are unsure whether their birth will go normal or not, okay, they are given the confidence, they are given the words. Did you hear one mama say that I preferred my midwife over my husband? I was more happy she was there with me. Okay, so going out of your way to take that place and that role to make their childbirth memorable. One of the research literature that I was reading says that the mamas are hyper alert during their birth experience. And that is why whatever their brain captures stays with them lifelong. The words, the actions, what people did to them, what people said about them, all those things stays with them lifelong. So our whole conduct, how we touch them, how we care for them, everything matters when we are given care to birthing mamas intrapartum. Can I go back to my PowerPoint, please? Can I go back to my PowerPoint? Screen. Slideshow. Well, so now I will come to the components of positive childbirth experience according to WHO. Okay, now put your heads and eyes and ears together, right? So this is something that is very evidence-based. It is not me, it is not my teachers, it's not my organization, it's the WHO giving you this evidence-based practices for intrapartum care. So respect and dignity, that's the first thing, which is a major component of positive childbirth experience according to WHO. So who is the hero of the birth? The mother, not us. मैंने delivery किया, नहीं किया, okay? She birthed her baby, right? Delivery किसकी होती है? पिज़्ज़ा की होती है ना? पिज़्ज़ा वाला लगता है delivery, okay? पिज़्ज़ा वाला जब delivery जाता है, पैसे मिलते हैं। आपने ऑर्डर की है, तेरा पैसा दे दो, तुम्हारा पिज़्ज़ा ले लो। Okay, that's not how we deliver babies. मेरी नौकरी है, okay? मेरे ड्यूटी में बर्थ हो रहा है, डिलीवरी हो जा, मैं अपना तनख्वाह लेके चली जाऊँ. That's not how we deliver, right? Okay, that's why we don't use that word delivery. We use the word. It's a very incorruptible, pure, a very we only support, we are support staff, we are not managers. Okay, support staff कहलाने के लिए अच्छा नहीं लगता है ना? When we see the official cadres, okay, support staff है, बहुत बुरा लगता है. Managers, wow, we feel very nice. In that way, we are supporting, we are not managing, right? Okay, and that has to be our outlook and mentality. And we have to maintain confidentiality and privacy. You see, that's our lovely working group Fernandez, and that's midwife Rajula, and she used to work with me in the government setting also. And that is a company. So something is being told to her. You see the way she's covered, her hand is taken in the midwife's hand, and the birth companion is involved. There is eye-to-eye contact, okay, and it's all happening in an atmosphere there is no limits. Right? Okay. अगर हम एक कॉर्नर में खड़े होके देख रहे हो her diagnosis, her abortion status, everything is told in the corridor. Everything is told across the beds. Okay, that's very hurting. That's very hurting. FTM trainees will tell you when we are taking history of the mother and we are asking them about their obstacles, the GPLAS. Okay, we don't ask them about kitna ho. Very hurting. That mama has lost her babies. Just like say nahi पूछ सकते. Okay, you could just ask कि आपने कितनी pregnancy था, right? Okay, she on her own will tell you, हाँ ऐसे ऐसे हुआ था, right? Okay, and then you have information to write for that A that you are supposed to write. Face front, if you ask that mama, okay, कितना abortion, right? You will never know how much you wanted that baby and that memory that, oh, I lost my baby. Okay, fine. And I'm really telling this to you with all my heart because I'm a mom who has lost my baby. I'm a mom whose second child was born with gun two. After carrying my second baby and being in that dilemma that I may lose my baby anytime because I'm so mismanaged. That night, the nurse was sleeping on duty. Okay, so there is a very big reason why I am what I am today. That's my passion. That's my vision. That I will not only serve the mothers, but I will teach others how to serve the mothers. That trauma is really bad. Really bad. Okay, my discharge instructions given to me was your child will be mentally retarded because child has suffered from asphyxia. You will have to coach him well in advance. Don't expect too much academically from him. Today he's a 21-year-old boy. God has blessed him so much. He is amazing. My child is amazing. He is talented in every way. He's a first ranker, he's a scholar, he's an athlete, he's a musician, he sings, he's beautiful. But that was my miracle. God gave me a miracle. This miracle may not happen to everyone. Right? Okay? So we have to really understand mothers. Today, when I have a flashback of what happened with me those 2 times, the time I had a miscarriage and the time I had my second baby, it's very traumatic. Very traumatic. It can draw me to tears even today. But I have got into a profession where I get to experience my own healing. Every mama that I serve, with every trainee that I train. Okay, so that is a healing experience for me. And it gives me a lot of joy to know that very soon we will have a lot of midwifery practitioners who will give quality, competent, safe care to mamas. And we will have babies being born with good cars, intelligent babies. Okay, we will have a nation who's full of youngsters who are vibrant. Okay, so the second thing we need to look to, this is stuck. So next thing is companion of choice. Okay, now that is not. She's our village girl in a sari, but look at that husband. Okay, if you give them time, they will care for their wives, right? Okay, and that is why I think if you have visited, how many of you have seen the MLU at SCP? MLU, the midwifery led units. How many of you have seen nursing students? Nursing students. Nursing students. None of you. None of you. They're not allowed to do that. Please come and see. I would invite you to come and see the MLCU. Okay, whatever I'm telling you here is practiced over there. So, okay. If you have not seen, tomorrow please go, enter the premises, see the MLU, okay, where there is one cubicle for one mama, okay, her family can be with her. It's all normality. You will not see it clogged with instruments and, a lot of medicalized stuff. If we try to keep it like it's not like a home, though I wish it was more like a home, but at least it is a low-tech environment, low technology, high caring environment. Okay, so there is a research. Companion of choice. What does it benefit? Okay, now doesn't only be husband. It could be sister, it could be allow somebody with that mother. Let her not be alone. She should not be laboring alone. It was never the design for labor. Okay, fine. Even from ancient times, women have been birthing with companions. Okay, so that increases the progressive labor, brings out good birth outcomes. The babies don't go more to an ICU. Okay, when the mother is relaxed because of birth partner, there is postpartum medical adjustments. Mothers don't show up with postnatal depression and psychosis. Right? Okay, those complications are averted because the mother feels safe during her childbirth. Mother-baby interactions are good, breastfeeding is established very well, and there is marital development. There is no respect in that companion's heart. That right? Okay, so there is a lot of love and bonding that takes place with that. Third thing is effective communication by the staff. So, When we say communication, it is not only communication between us as staff, but our communication with the mom, our communication with her birth companion, our communication with her family. Okay, many times when even you and me today go to hospital, and moment we back the ball, only one of us go inside, and then after coming back, nobody knows what happened inside. If you remember everything, you will tell your husband. Otherwise, क्या हुआ क्या डॉक्टर ने बोला ना कि डॉक्टर आते बोलते थे कि oh this is it or something like this needs to be done. अभी कोविड तो चला गया लेकिन आज भी वैसी. Okay, we don't. हाँ आपको बताया ना जब ले लो. I think yesterday one of the sirs was saying कि अगर दवा देते तो हाथ में देते वो उठाओ करके बोलते हो. Yes, sir, I think he was like mentioning that. Yeah, when you give medicines to mamas. So actually you should be there just so that they understood. Was your communication clear? Okay, help them repeat some important things. Yeah, do you know when you come back to hospital? Tell me what the 5 things I told you. Let the mama tell you back. That's called a check back in your communication. Check back. Okay, whether she understood. So inform the mother, make her empowered. The team communication is important as well. Together as a team, go and speak to the mama. It's nice to know who my doctor is. It's nice to know who my midwife is, right? In MLC, there are no doctors, but they should know their midwives or the team of midwives. Today, we are 2 of us. Okay, how many of you have traveled on the plane? How many of you traveled on the plane? Okay, for those who have gone on the plane, right? You will know that at the start of the flight, they say today your the food is this and this, right? And we speak this language and this language and this language. Okay, so they introduce the team to you. You know who your pilot is, you know who you is, you know the leader of you, right? Okay, so that's something nice. It makes you feel so good. Yeah. So imagine you being in that place, you being the for your mama who is breathing there. Okay. Now, pain relief, that's a whole big topic my friend is going to talk. I'm not going to touch it at all because I'm sure she's going to do a great job of that. So if you see, I wanted that one very picture that mama is with her mouth wide open. What is she doing? What is she doing? Huh? Shouting, screaming. Yes? And what will we do then? Chup ho jao. Hai na? Okay? We don't like people screaming. That is her coping mechanism. She is coping with her pain only by opening her mouth. Right? And that's fine. That's okay. Some mothers scream. They just feel like screaming, and that's okay. Right? If you shut them out, you are limiting their coping mechanism. Okay, fine. So respect that. Even if the mama scream, you should be able to keep your cool and say, okay, I'm still there for you. It'll be nice not to waste your energy. Just feel like shouting it out. It's okay. No problem. Yeah, okay. So hot showers, aromatherapy, giving her good positions and back rub, making her sit reverse on a chair and allowing her husband to give her a good back massage, different positions on the floor, on the floor. Yeah, okay. Many mothers can't work on beds. They're very uncomfortable. Yesterday, my friends and we were having a discussion. कि कोरिया में लोग कैसे कैसे वर्क करते हैं, है ना? घर में बहू रहता है, ओके? उसको पकड़ के दे स्पॉट एट द बर्थ, है ना? फिर एक रिपोजो जैसा एक साड़ी लटकी रहती है कहीं से ऊपर से, उसको पकड़ के बर्थ करते हैं, right? Okay, people need different kinds of support. They are not supposed to be on that steel table. नीचे रहो, पैर ऊपर करो. These things is not something mamas love. It's so natural. So we stand with physiology. Okay, fine. Next is regular labor monitoring, checking her vital signs, maternal monitoring, fetal monitoring. Okay, the midwives will do intermittent intelligent auscultation. We don't use the CTGs unless and until it is required. So we take the intermittent auscultation with a Pinard's fetoscope. Yeah, today we are more stylish with doublers. Okay, so doublers have the good benefit that mama can hear her baby's heart rate also. With Pinard's only midwife hears. With the doublers, mama is also here. Okay, fine. So we have to do the partographs. Okay, do you all know partographs? For how many a partograph is a big tension? For those who are not used to monitoring, partograph becomes a tension. Okay, but it's a lovely tool. It's a lovely tool to keep the mama's labor monitored and safe. It's a very beautiful tool. Okay, learn to love your tools. Yes, okay. If a gardener doesn't like his shovel, okay, if a driver doesn't like the steering wheel, just is. Love your tools. Love your gadgets that you have. Simple things. My BP apparatus. Save it. Don't drop it. Don't spoil it. Where is my thermometer? Take inventory every day. I need my thermometer. I need my BP app. I need my Doppler. Okay. इसको क्यों हर shift पे पूछना चाहिए. Okay. These are our tools. We work with them. Okay. So cherish them. This is a very big thing. Dr. Rebecca Decker is a very lovely writer. Her site is a bit expensive, but she writes very beautiful. So in one of her sites, she says, that's a site called evidence-based birth. Mothers who are in labor, there's an increased risk of prolonged labor by how many hours? Which lasts for 1 minute is so big. 1 minute contraction. In strong contractions, you have contractions that last maximum up to 90 seconds, 1.5 minutes. Okay? So if one contraction of 1 minute is so painful, imagine getting relief for 1.5 hours. Is that not big? It is big. So if just by giving food and fluids to mama, you're going to cut down her labor, do it. Keep her hydrated. Keep her strong. Keep her going. Okay? So that is research. That's research. Okay? Then, next, continuity of care. So what does it mean for mama? Okay? One nurse, midwife comes and goes, please hand over the if you have again. If you are mama has not birth, she has been sent back and forth. Someone on the ship say, I agree with that mama. I have cared for her yesterday. Continuity of care. She knows your face. She knows your voice. She feels friendly with you. Give her that care. Her oxytocin will be very high. Okay? During birthing, we need one very lovely hormone. We need oxytocin. What do we need? Oxytocin. And another name of oxytocin is a love hormone. What hormone is it? Love hormone. Okay? So in the birthing rooms, we need love hormone. When we scream, when we yell, when we scold, when we slap, okay? Which hormone is coming? Adrenaline. Fight and flight and freeze hormone. Okay? Yes? So we don't need that hormone. What do we need? Oxytocin. And because we bring adrenaline, we bring oxytocin from the fridge. When mother has it inside her. Mother has her own oxytocin. Use that. Don't use oxytocin from the fridge. Okay? Yeah? So love hormone is what we need. That makes the mama feel safe and it gives her security. Then mobility. Okay, so my next whole session is on mobility. Just for 20 minutes, I'm not going to keep you long. Okay, so what does evidence say? It reduces discomfort, brings down abnormal births, that is instrumental births. It reduces perineal and vaginal trauma and reduces the risk of wound infections. So keep the mama mobile. Very important to keep her mobile. Then discuss the plan of care and referral. Very important. Please discuss the plans. Okay, mama's birth is going normal. Keep the partograph, monitor mama, monitor baby, and then when you are maintaining the records, and if you see any deviation, let the multidisciplinary team know. Discuss her case. How do you discuss? There's a mnemonic there. We all our trainees here, NPM trainees and our educators, we follow this during our handovers. It's called the S-bar. Okay, S for situation. We tell the situation. Before that, we do the identification. Some also say this bar. I is for identification. So I have Miss so and so. Her situation is intrapartum second stage, and her background is she is GB2 P1L1, and she's 39 weeks. Her HB is 11 today, and she's had a normal pregnancy. Her first stage has been uneventful. She's well hydrated, passing urine, blood progress is normal. That's her background assessment. I have just done her palpation, and she is 7 centimeters now. Going into transition, the baby is doing well, fetal heart rate is good, the station is at 0. Okay, contractions are 3 in 10. Okay, so that is the assessment, and her vitals are stable. Her whole mobility is good. She is doing very well. That's her assessment. So what are my recommendations? Continue giving her support, maternal fetal monitoring. Now she will go into second stage. So do fetal monitoring every 5 minutes after every contraction. Continue to encourage the mama, give perineal warm compress at the second stage, and be there to support her. Watch for the baby and the nipple progress. That's my recommendation. So this is how we give handovers. Okay, so communication and plan of referral has to be there. So this S bar has come from the Navy, the discipline of Navy, when they used to give SOS calls for help. The handover is to be in S bar. Okay, so I would like to say a good birth goes beyond having a healthy baby. And this is one very good trial of care. I'm going to skip this and I'm just going to let you know about our study at Nampally Area Hospital. Okay, so at Nampally Area Hospital, we have done a clinical audit of what our care is. So that's the hospital where I have worked for last 2 years. And we took a feedback of 159 mothers. So most of them were from 20 to 25 years of age, and many of them were multis. Then their hemoglobins, if you see, most of them, 60% had more than 11 because they had come to midwifery clinics. Okay, more than 60% visited the midwife at least once. So that was our clinic visit. 40 of them had not come. Episiotomies, only 6%. 90% mamas did not have an episiotomy. Okay, so 39% intact periods, 36% only first degree, 19% second degree, and only one mama had a 4th-degree tear who was appointed. Then maternal care measures, 100% used comfort devices, all of them, Somalia, birth ball, peanut ball, walking, and massages, all of them use that. 82% were mobilized. 18% because they came PROM, the doctors didn't allow them to get out of bed. Those were some of our challenges. Perineal warm compresses, 95% got. Some mamas came and birthed within 10 minutes, so there was no time to even give perineal warm compress. Birthing positions, we had changes in birthing positions, propped up, all four sidelines, squatting. So you see our mothers in government hospitals birth in these positions. No lithotomy, 0% lithotomy. Newborn care, 97% had skin to skin. 3 babies who were compromised had to go to an ICU, and that is why they were transferred and they missed the skin to skin. Initiation of breastfeeding for 96 babies, 96% babies, only 4% could not because they have to get transferred. Overall satisfaction with midwifery care was excellent. No mama marked the midwife's average or poor. Good was only 2% and 98% feedback was excellent. They felt really cared. It's a government area hospital, a 100-bedded area hospital where we have a midwifery clinic and care. So what were the things that they did? They felt valued as women. They had a trust relationship with the midwife, compassionate patient care. They were given information on pain relief. They were given options for positions in labor. Their choices were respected. Midwives listened to them carefully. Nutritional needs were attended. They were cared by skilled professionals. Breastfeeding support was provided. Skin-to-skin care was given. Postnatal care information was given. And postnatal visit was paid. The midwife went to see them the next day. They felt happy about that. So with all this, our mama said that they would recommend the midwives to others, right? And they also have good memories about that birth experience. So we got 100% satisfaction from our mamas. So here I want to say there are grave dangers out there. So when we have grave dangers, they will give birth to great solutions and resolutions. So you can resolve today what you want to do, what you want to be, how you want to care, and what you want to do for your community. Okay? So this is about intrapartum care for positive birth experience. Now we are going to take a very short break. I want you all to stand and stretch. Okay? Come out of your seats and go back to your seats again before we cover a 20 minutes presentation on birthing positions. Okay, with the demonstration. So we will arrange the hall till that time. Just come out and stretch. Okay, fine. Thank you. Thank you. Thank you, Sital, for your valuable and enlightening space. So we will remain here and for the next session on the alternative bathing position, how to effective for the ensure a healthy mother and healthy baby and conduct a normal delivery. not demonstration, but I just need to give you a little overview what research says about birthing positions, and then I will show you how you should help the mom for this positive birth experience by giving her alternate birth positions. Again. Okay. So upright positions. Now talking to you about positions, the motto is go natural. Okay, what's the motto? Go natural. Okay, Abhi, my dear friend is here. Hello. इतने देर तक पैर दो नीचे करके बैठी थी. अभी क्या हुआ? है ना? You felt like changing position. Huh? You all were so happy that the Mrs. Sheetal gave you a break. है ना? Everything sitting on those hard benches, something is happening in the back. Yeah, right? No matter how much you like it, sit in one place. Same thing happens to the mom. You can imagine, labor is not like this 1.5 hour lecture. Labor goes on for hours and hours. पर हम उनको क्या करते हैं? और अभी यहाँ आप कैसे बैठे हो? Nicely. Yes, हाथ इधर है, पैर के लिए जगह है. Right? Okay, इधर उधर घूमने के लिए जगह है. आपने वो लेबर टेबल देखे हैं? देखे हैं? Half the size of the woman, right? And she's expected to be there in that lithotomy position for hours. It's so painful. It's so painful. Can you think about it? Yeah, I can't think being in that position. Oh my God, I would run away from it. But I would prefer birthing on the floor. Okay, because of all the mismanagement that happened, I have had 2 cesareans, I have 2 boys. But had it to be a normal birth, I would even prefer a floor if that was going to be the birth experience. Okay, fine. So there is no that mom must give birth in a lying position, right? Okay, a mother can choose to move around into different positions for baby's birth. Throughout birth, there are some laboring positions mama may take, and there are different birthing positions mama may take, right? Okay, we have mamas even on those steel tables. Okay, till the time the baby is they're in a completely different position. The moment the crowning is taking place, they will flip themselves very fast into some different position. We may not be able to reach the perineum. Baby hair, baby pops out, baby restitutes, and then we are ready to give gentle axial traction to get the baby out. Right? But mama does the job great, and she has the liberty to do so. We tell her, चाहे वो करो, नीचे आके बंद करना करो, खड़े होके करना करो, आपको टॉयलेट में बैठे ऐसे करना करो. Okay? Her baby snuggles out. Right? Okay? It's her choice. Whose choice? Not our choice. Right? Okay? Fine. Upright positions. What does research say? It favors biomechanics and physiologic adaptations to labor. What does gravity do? Are we all fond of gravity? We are seated down here. Otherwise, we would be floating in this lecture. Yes? Okay? So gravity helps things to come towards its force, towards the downward direction. Okay? That's what happens to baby. Maintain fetal flexion. All of you, I think, in third year, some कोई normal mechanism of labor करे हो? Okay, करना है अभी. That's why butt pelvis is called, but I'll show you something about that. Okay, fine. So baby has to pass a small narrow section, right? Okay, and baby's head has to flex. We want flexed heads. We don't want deflexed or hyperflexed heads of the baby. Yeah, right? And then optimal fetal positioning is the key. Baby has to be positioned, right? Okay. If I tell you, ऐसे ही बैठो, okay, with crumb silence, हाथ मोड़ के बैठो, you will not sit here for long, right? We cannot give those compulsions to baby. ऐसे ही आना है, मम्मा को टेबल पे ही बैठना है, lithotomy में नहीं चाहिए. Baby cannot come on. Baby doesn't find a way, right? Okay. So types of positions, there are supine and they are upright. Supine में lithotomy में lateral positions है. Upright में sitting, kneeling, squatting, and all fours. I'm going to show you all this. Okay. We birth the mamas in in all the positions except in mama. Okay, if you saw my slide, even in the government hospital, mama sit in birth, that is propped up position, mama squat in birth, mama go all fours, okay, mama goes left lateral, right lateral, they birth in different positions, okay. Lithotomy is not one bigger. So, birthing again is a human right. Choice of birthing position is a human right. So, of upright positions, okay, it increases the likelihood of a spontaneous vaginal birth. There are shorter labors, good fetal blood circulation. It will reduce the likelihood of assisted vaginal birth, labor dystortions, and cesarean section. Is that not good? Very good, right? Who doesn't want short labors? A baby coming screaming, pink, nice, healthy, right? Good blood circulation and no labor dystortions. Nobody pulling at your baby. You know the positions, right? How the people will wait to receive the baby like this. Yes, it's an attack position. It's not a receiving position, right? Okay, did you all see me? Eagle eye, eagle contact, gentle hands welcoming the baby. हम लोग ऐसे जैसे खड़े हैं उधर पहुंचने के लिए उसको ओके कब जाएंगे उसकी गर्दन के पुल करेंगे बेबी को oh my god babies need to come out happily. They need to snuggle into the world, don't get pulled into the world. You understand? They will take their time. Allow them to just sweep out nicely. हम जब सीखते हैं तो अच्छे से बोलते हैं since they put face and chin will sweep the perineum and come. लेकिन sweeping के लिए time नहीं देंगे. Let it sweep. Let it come on its own. The baby out. Unless and until the baby is in distress, they require forceps, they require a vacuum. Okay, baby is compromising. Then yes, then you have to give an episiotomy, apply an instrument, get our baby out. Okay, that's emergency. That happens how many percentage times? How much? You got it right. Okay, 80% times babies have to come in their own time. Right? Okay, good. Lithotomy. What happens in lithotomy? There are obstetric anal sphincter injuries. Anal sphincter is a sphincter. It's a rubber band of your body that tears. So rubber band एक बार tear हो गया, then they will start leaking feces, fecal incontinence. Okay, flatus incontinence. Yeah, that is such a shameful living for that mother. और कोई मम्मा आती है? Does any mama come back to say, मेरे यहाँ में वो हमेशा पैखाना निकलता रहता है ऐसे बोल के कोई आता? They don't. They feel so shy. Our community ladies are so shy to say something. फिर that sexual life is affected. Husband will divorce them. उनको छोड़ देंगे. Okay, marital life is gone. Right? Self-esteem is gone. वो कहीं public में नहीं आ सकती. Right? Whole life she's wearing diapers or she's wearing some extra cloth inside because she's leaking feces. Right? And that happens because of these positions. Abnormal fetal height. Babies will get compromised. Baby comes out with low abdomen. Then urinary incontinence, so much of pressure. Okay, bladder will get so much of compression that it will go into a cytocene. There'll be incontinence. Sometimes because of forceful labors in this, there are buttonhole injuries, there are fissulas, okay, and mothers suffer a lot. Sideline. Where is my peanut ball? That's a lovely ball. Okay, peanut ball. Okay, peanut ball. It's classical. It's very nice. It keeps your acetabulum and your hip joint open, right? And the sacrum can go behind nicely because sacrum is not on a table. It's suspended behind. Okay, you can give warm perineal compress to the mama. You can massage her back. You can hold her hand. Husband can sit and give eye contact and talk to her. Not only husband, any birth companion, and she will progress slowly, nicely, and the tears are minimal. Sitting position, there is less labor pain because baby comes out fast. Gravity. Okay, short and second stage of labor, few episiotomies, but some researchers have shown that there could be obstetric anal sphincter injuries and increased blood loss. But the blood loss is not significant. Okay, there are a lot of studies, lot of systematic reviews with that. Okay, the Cochrane reviews, many, I think about 18,000 samples They have studied and brought out very fabulous findings, but it does say this increased blood loss was debated quite a lot with the birth stool. Okay? But now people have said that the blood loss is not significant. Okay, some low quality studies have been filtered out from the systematic reviews, and then they find that as compared other positions, sitting position does not give more blood loss, which is not significant. But there are a lot of benefits. Kneeling position, short and second stage, few perineal tears. Right? Mothers can kneel, but it is always better to kneel on the floor or on a gym mat. Okay, on a chatai, than kneeling on a bed. Cushioned bed में pressure नहीं लगता. Okay, fine. Okay, that's nice. This is a dangling squat. That's a dangle squat. Okay, mother is dangling in between your hands, right? A partner can do that. Okay, and it is a short. There is a evidence of shortened second stage and less stable pain. So these are all my references. These are all beautiful studies about what these positions are like and what they do. They are very detailed, free access studies. Okay, I have sent my presentation to your principal. If you want, you all can take that, go through these studies and look out for yourself how you can birth the mama safely. Okay, so with that, I say thank you, and I'm coming now to my demonstration. Okay.
Yes, yes, yes. So, all my ladies and interested gentlemen. Okay, I'm very proud about my gentlemen who are sitting here. Okay, I'm really proud. They're sitting for all of us. Yeah. Okay, good. I like this smile. Fine. So, they're having their teams, enjoy their team. This is a video practice. Yes. Okay. Yeah. And this is basic sheet. And the baby is going to snuggle through this. Right? Okay. All right. Yes.
Yeah. Okay. Fine. Yeah. So the baby has to go through this, right? This is sitting in our body not like this. It's sitting in our body like that inclination, right? As you see degrees inclination. So if this surface now has to go like this, okay, has to go like this, and then the baby is supposed to push like this, right? Would it be easier for the baby? No. Yeah, why not? There is no rational force. Unless there is forward action, there is no help to push the baby horizontally. Okay, what is this position? Horizontally. Well, even if Oman slides push, you don't make a moment of that, right? Okay, what happens going up to Mama on their back? Can you say, Mama, wait a little bit, right?
sacral joint. Okay, that means so impacts that this oxygen will come to the baby. Okay, it will not help to widen the outlet. Our outlet is actually posted out measured from the sacral oxygen joint to the lower water body. So like this, okay, baby जाता है, आते हैं ऐसे. Okay, so imagine baby going inside, baby has to take a bath. Rotation लेके baby को ऐसे आना. Right? Okay. So wait, inside, and we have to help the baby. Jaan ke liye help me. Yes or no? Yes. Okay. So when that baby head is going inside, okay. Abhi dekho. Ye hai what we want? We want complete flexion. What we want? Flexion. How much flexion? Till you see the posterior one. Till you feel the posterior one. Chin to chest. ऐसे होना चाहिए baby. And you should be complete flexion. So when baby is going like this, suppose the baby does not flex. क्या होगा? Baby is making snap. Moreover, the coccyx is not nodding. It has to nod. Okay. Large brains from 6 months onwards, there is one body hormone called as relaxin. Okay, it starts getting secreted in the mama's body in pregnancy. What is relaxin for? All the soft tissues, ligaments, tendons will get supple and soft. By the time of labor, this bone is already no, this whole girdle, the girdle is already, but it is loosened. It is loosened. So that it can expand. It can expand. Right? Okay, fine. So God has given some help, and we need to give the external help to that moment to give her a positive word experience. Pain isn't going anywhere. No, it's a principal parameter. Pain is not going anywhere. Pain is there. What are we changing? Perception. What are we changing? Perception. How mom perceives that pain is what we're gonna change. Okay? So if this baby's head is well relaxed and it's going to come out, then what will you do? Then you will nicely see the sensible face and chin will sweep the perineum and the baby will be born with exit. Yes? Okay? अगर इस बेबी को ऐसे कैसे भी डाले तो वो बाहर नहीं आने वाला. Asymmetrism. ऐसे बनाएंगे, right? Okay? But if the baby is well flexed, that is why we require what positions? Upright positions. Okay? Baby has to come down. यहाँ पे जो muscle है, there is like a hammock. It's like a hammock. If you understand the hammock, बीच के side पे झूला रहता है. हाँ, तो नानी पेट के बीच में जो लगा रहता है झूला. Okay? वैसे musculation है, right? यहाँ से यहाँ, यहाँ से यहाँ, यहाँ से यहाँ. Okay, it's like a hammock. Okay? Our pelvic floor is like a hammock. So when the baby is coming inside, there is a fetal axis pressure from the baby's spine. Baby occipital pressure आएगा तो baby का सर नीचे जाएगा, head होगा, and then baby will, the occipital will come to the pelvic floor hammock जैसे है, इसके वो क्या हो जाएगा और so flex हो जाएगा, फिर turn हो जाएगा, फिर आराम से baby will emerge with extension. You understand? Okay. So the muscle, the mama's contraction force, mama's position, mama's natural oxytocin. Everything has to be this. Okay? With all the lecture that we have in the morning, you think we can make it possible? Can you make it possible? Yes. This is important. You keep the mama comforted with the birth companion, hydrated, okay, happy, informed, good consent, mama is being supported, your oxytocin is high. High oxytocin, good contractions. Good contractions, high pushing force. Right? Good pushing force from top, nice opening of the cervix and the pelvic floor. Good flexion of the baby and good birth. Yes? You know that. Okay, fine. So I want you to remember that this bone will rock. Okay, the sacrum will rock because it's relaxing. The sacroiliac joint will get loose. This will rock. This will go behind. It will widen the diameter. Right? Mama will be feeling sometimes awkward. You know, have you seen mamas who walk in the labor room, ऐसे चलते हैं. You understand? Okay. Normal तो ऐसे नहीं चलेंगे. Pregnancy में तो ऐसे नहीं चलेंगे. But when labor pains start, they start doing it. क्यों? Because babies are telling them to wiggle them to do. Yeah. You are changing positions so often when you're sitting here. Not because your body is telling you, Mama, change position, right? It's close to Mama. Mama, this position is not good. My head is not going well. I am not going to change. Okay? And Mama will change, right? Okay? By the time you go, oh, and she will change to another position, right? There's nothing happening. Allow that to happen. If you sit better, right? Because she's doing exactly what her baby is asking her to do. Baby inside her, not inside the doctor, and not inside the midwife, and not inside the nurse. So we cannot dictate what she needs to do. Just leave her with free mobility. So mobility in labor and birth is very important. Okay, fine. So did you understand? Yes. So we need gravity. Horizontal motion is painful. We need reflection, and we need time for the baby to emerge through all the locations and come happily outside. Okay, yeah. And all that baby is going to be monitored. Baby is going to be monitored. It's going to be monitored. And monitored. Okay. This is what you're here. This is on the tummy. और जब मम्मा के tummy पे जाता है, okay, तो हाथ छोड़ देते हैं. Coming in between your ear and mama's tummy. इसके पहले calculation करना पड़ेगा. So take the baby, rotate the baby's back, put the pinna stethoscope, okay. Check the mama's pulse, time the heart rate, and keep the hand, okay. Keep the hand check. You understand? Don't have to hold it. It will intervene. Okay. So yeah. Now we will go to different positions. This is a birth ball. Okay. This birth ball has plus resistance. Okay. You should all try. आज MLU से ball यहाँ आया है. MLU से आया. MLU से यहाँ आया. सब कोई इससे बैठ के देखें. हाँ. वो बड़े जंप में जाते हैं तब बहुत अच्छा है वो जंपिंग. हाँ. That's okay. उससे बैठ के देखें कैसे होता है जंप करने से किसी भी बैठ के देखें. How it feels, right? Okay.
स्ट्रेट आपको क्लीन करिए
आप ऐसे मत करो. हाँ. This is because you need to see. बेड के ऊपर बॉल रख के मम्मा को उसके ऊपर नहीं चढ़ाना. This is considered slow. Normally, this is slow. This is because for you you get me. Yeah. Okay. So mama is sitting. Okay, and we have a birth companion, right? Now I'm not a midwife. I'm a birth companion. Okay, fine. Maybe I'm her sister, right? I'm helping my younger sister to birth her baby by giving her a care, back massage, mobility. Right? Okay. So what is the midwife has told? कि उसको थोड़ा क्या करना है? लंबा लंबा गोला लगाना. Okay? लंबा. Okay? पैर चलने को बोला है दीदी. पैर चलो. चलो. Okay. Good. Okay? लंबा सा सर्कल करने को बोला है. लंबा. Right? Okay? So when this she is doing, gently. Painful. Okay? So when she is doing, these are called gyrations. These are called as gyrations. When she is doing this, you can imagine. This pelvis is actually going like this. Yes, right? Okay. Anti-clockwise it is going like this. So a baby who is a single thing, right? Okay. Let's change the position. Let's change the position, right? There is no resistance from that. The sailor can still know it. Okay. When the labor pain comes, she can bounce on the ball. Bounce, very nice. With the labor pain. Deep breathing, PJ. Blow out. Yeah. Good. Okay. So when she's bouncing, again, what is happening? Baby is getting space to change position. Okay, pelvis is going up and down. Baby is rotating nicely. Baby is getting position to change. है ना? अगर इसको मुझे कवर डालना हो, तो मैं क्या करूँगी? इसको घुसाती नहीं हूँ. क्या करूँगी? इसको अंदर पूरा डालूंगी, and I will do this. They under? Yeah, simply like that, right? So when the baby is negotiating the birth canal, when the mama does the exercises, bouncing, okay, side to side TJ, okay, side to side, okay, back and front, okay. So it is nodding. See this? The pelvis is nodding. Yeah, okay. So baby को हल्का हल्का धक्का मिलता है. चलो चलो, head का position change करो. And mama takes the most comfortable position when baby settles. When baby settles. Okay? So ये हुआ. This position mamas are helped with when they are laboring. Not birthing. They don't birth at the right one, but they are laboring. Okay? Birth के time क्या होता है? You can use the birth ball like this. Please come kneel down on the bed, please. Kneel on the bed. Yes. Okay? Please here we go. Keep on one side. Get it up and down. Okay? Good. Okay? And mama can go back and forth, right? Okay? This is a very comfortable position for her. As a birth भी हो गया तो चलेगा, no problem. This is an all fours or a kneeling position that she can take. Back pain हो रहा है, तो of course this is the bed. So maybe the partner can stand, okay, and give her a double squeeze, nice squeeze, right? Okay, during contraction, or can give her sacral pressure, okay, the pressure for pain relief that can be given, right? Or can give her light strokes. Some mothers don't need to give her. Please say हाथ मत लगा. Okay, good. तो हाथ मत लगा. Just maybe just stroking her head, giving her some water, okay, giving her fluids to drink. नारियल पानी दे दो, ORS दे दो, कुछ तो उनको देके hydrated रखो, okay, and she's doing her exercise. And what happens? You can give her hand. When she gets the contraction, she'll feel your hand, right? You know she's contracting them, right? Okay. So you are observing her contraction. If you gently place your hand on her fundus, you will know whether it's a mild, moderate, or strong contraction, right? Okay. Then you can take a Doppler. You know where the baby is. LOA, ROA, how it is. You can check the baby's fetal heart rate even in this position, right? Okay, so this is one birthing position, right? With the birthing ball. Then have the peanut. और इसका दूसरा ये हो सकता है कि मम्मा को खड़े-खड़े बर्थ करना है, नहीं सोना है. So this. You understand? She can be like this. This is also good. So outside the bed, what can be there? You can birth mama in a standing position. That is also upright. On the bed, ka ye to kneeling position with the ball. Okay? अपनी labor room में अगर bed में convert हो गए, you can do all this. We just need more space on the bed. Okay? So you can go. Let's sit down first. So when the mama is sitting, mama is relaxing during her labor phase. You can give her this position. As I told you, if baby is in a difficult position, not able to come down, this gives like baby is stuck. Mama बोल रही है कि बहुत पेन है, बहुत घट हो गया इधर पे. Okay, तो क्या करना पड़ेगा? ये पैर को थोड़ा ऊंचा करना पड़ेगा ताकि baby will snuggle to that side, right? So you can give her this position. Right. Okay. So widen the pelvic diameters. I'll give baby the space to come down. So this can be during laboring. She can sit and deep breathe like this. Okay. You can check the baby. You can check her BP. Right. Okay. And then when she goes into active labor, the baby, she almost feels like, no, I feel like pushing now. Something is happening to me. Then she can take this ball in a left or a right lateral position. इसके लिए थोड़ा फ्लैट होना पड़ेगा आपको. Okay, so now you see when she's like this, the sacrum is pushed outside. There is good space for the baby to come, right? And she's relaxed. You know that before the second stage expulsive contractions begin, there is a lull, there is a silence. Mama goes to sleep almost 15 minutes ke liye, 20 minutes ke liye. She actually sleeps. So that's the lull before the next expulsive contractions begin. So at this point when she's resting and then she starts contracting, some mamas instinctively they will fold their thighs, and take it up and they'll start birthing their baby. Okay, so a peanut ball gives the left lateral position in such a way that it allows the diameter to widen and the baby to pass with the normal contractions. It may be a little slow. Because there is no gravity, it will be a slow push, and that is why there are less perineal tears. Okay, if the mama squats, it pushes fast. So sometimes perineal tears happen. Lateral way, beautifully the perineum will open, but you should have patience when you're birthing mama in the lateral position. It can be left or right lateral. Okay, fine. Are we all for it? So all fours there. You need a bed. We have been asking, I think MLC में जाओगे तो you will see the beds where जिसका head है ऊपर हो सकता है. For that matter, जो अपने steel वाले labor tables है, we have the labor tables. They also can be lifted up. Yes, so you can give this position even in the labor room. You can. Okay, if you want to, you can do wonders there. Right? Okay. So this mama can come to our lab. Okay. So yeah. Okay. Suppose I am her birthing partner. Okay. ऐसा कोई bed है जिसको headrest नहीं है. This is a position she can take. Yes, this is a position she can take. I can be that head up thing to whoever mama hai, sasuma hai. Okay, anybody can hold her, and she is going to feel so comfortable, isn't it? Okay, somebody of mine is there, so she can birth in this position. Sacrum is not on a hard surface. Sacrum is suspended. Okay, baby can come out and support it. We might there. Baby come on the wing ho jayega. Right? Okay, these are some wonderful positions that mama can do. Or then there is no possible. Okay. After a modern materials, the textbook okay, you will be studying your textbook. There is a modern materials. What is the modern materials? Sacral bone okay, you actually see the robbers from the mama's sacral. Right? You will see the that means hey, mama is dilated, they will progress, baby almost coming down to 7 to 8 centimeters. That's when the sacral starts to shape up. So we don't have to always project the examination. You observe the mama, see her body shape, see her bones and bones, how her body is changing, how her breathing is changing, how her gait is changing, and you know, this mama is not practicing. That is nothing to do. I think not know that it's like right? Okay, and that is what we want as it was. Mama is very powerful, not for your examination. Painful head, you observe the mama. Okay, but if it is very, very necessary, she's really fresh. Okay, you can say I don't have a problem. You have a consent taken, explain one day, then you will do it. Okay, fine. This is respectful. You have had to pay for what I don't know. Yes, okay, fine. So, yeah, this is another position. Be very happy. Mama is happy working in this position. Squatting position. Right? Okay. Or mama is most used to their this. Right? Okay. So squat pass it. Because our mamas know how to squat. That's the reason. Okay. So if you allow the mamas, they want to squat. Instead they want to squat it. Sometimes they support to squat. They take a supported squat like this. Or something is squat. Okay. Something you hold the squat like this. Okay. Okay, so that is how we want to do. Okay, so we are squatting. Okay. Lunge running position. Okay, run start position. So those are all several upright positions. Mamas apne itna nahi karte. This position is not what they are comfortable with. And the word is put out. Rebozo. Okay. Now sit there. Reverse chair में bird नहीं कर सकते. That's the living reality, not bird. Okay. So I will rebozo. Okay. अभी ये mama. Now अपने labor room में this happens very frequently. Mama ऐसी है. Okay. Mama is not able to push. Right. Okay. So क्या कर सकते हैं? Yeah. तो ये हमको we use rebozo. अभी देखो पढ़ना है. लेकिन rebozo is a Mexican concept. Mexico में during birthing, the traditional mamas used to use a sacred cloth that is woven by the mama throughout pregnancy. Okay, वो mama का बहुत special, it's a very holy cloth for the mama. She uses that cloth for labor. She uses that cloth to swaddle her baby. She uses that cloth when she's carrying her baby for the first time outside. So that cloth is a very, very beautiful cloth in Mexico. So that's where the word rebozo has come from, right? Okay. So I'm using this other rebozo. Yeah. So we tell the mama, आपको इसको पकड़ना कैसे ऐसे okay fine आपके पैर ऊपर लीजिएगा right okay okay so she's not able to push so I'm going to give her a help. This is difficult. ऐसे में table is useful. We don't do reposes on beds. Okay लेकिन अभी मुझे जगह नहीं है इसके लिए okay so when there's a contraction it is like a tug of love, tug of war नहीं. She will push me towards her, pull me towards her, and I will pull her, and she will give her contraction first. Okay? चलो start करें. Yes. Okay? ऊपर आ. Yes. So when she doing that, the baby keeps coming downwards. Okay? And this is how this requires a lot of strength from the midwife's part. Right? Okay? So mama is going to pull towards her. And the wife is going to hold, okay? And this is a very good non-touching. Very good non-touching, right? Okay? So her partner is there. In between, she has sips of water. We will monitor her what is happening. बीच में छोड़ सकते हैं. कभी सांस ले सकते हैं. And then she can keep doing this rebozo to get her baby out when she's in the pushing stage. Right? Okay? So this is the use of rebozo. Rebozo का दूसरा ये भी है. Standing यहाँ नहीं है. I want to show them average. Baby नीचे नहीं आ रहा है. Okay, almost looking like prolonged labor. Mama is complaining too much sacral pain. Back pain बहुत है. Baby is having time. Still, feeding examination करें तो baby is here. Okay, or head is not well rotated. Still the dilatation in the transverse diameter. Okay, तो क्या करोगे? There is one nice procedure called as shake the apple chip. क्या बोलते हैं? Shake that. Okay, so you put it like this. You are going to shake the mama's pelvis to shake the baby inside. Okay, to a good position. So you do that, right? During the contraction, right? And this is very good. आप लोग भी first में एक दूसरे के लिए करोगे ना बहुत अच्छा है back pain. This really do, right? Okay, we do this on one another. We advise we know this art, so we do. Okay, so this is how you can gently put the baby to turn. Okay, बहुत natural है ना, कुछ भी ज़्यादा नहीं common sense, no rocket science. Something that is just helping our body to work. Okay, so this is all I wanted to say and all I wanted to show you. Now I'm ready for questions. Okay. Thank you, Sanjukta. Thank you so much. May I have them? These positions can be used as a state of labor. Okay. Is able to move where the pelvis is able to move down. Pain relief, work on objectives. Yes. Baby has already engaged. Engagement means baby is not going 80 has an age. 80 comes in transfers diameter and 80 is studied to optic diameter. Now I get this marker in the model here. It will only be set. Reminder, Lancet series, okay. Now, Lancet is a journal, a very high impact, global, wonderful journal, okay, where only good, robust, randomized controlled trials, very good studies are published. So, this group midwives have come together, some very, very powerful midwives from the international confederation, midwives, educators, clinical clinicians, consultant midwives, and then they decided to see what is happening globally with mental health. Okay, and they wanted to very much believe that midwifery was the answer, but they needed to down the road as to what midwives can do, how much they are already doing. So that is why I am looking the data at this show. How much qualified midwives are taking up the burden of quality care? And if the other midwives who are A&M, GNM, okay, with different qualifications, if they are all brought to the same quality of education, if they have given extra education and brought to greater competencies, then these midwives also can save from us, right? Okay? Then what is happening in third world countries, like the rural and middle income countries, where they call it the LMICs, and the high income countries of the HICs. So they divided this whole world into different countries, and then they have studied nearly 72 countries and brought up data of what is happening with maternity care. And a whole series of studies brings out that there are 4 papers, that's a series of 4 papers. Okay, so those papers are free access, you can read them. There are maybe 50, 4 papers. And then they tell us like how midwives are taking up nearly 83% of service group. And we can change outcomes, right? And we can change the whole statistics of maternal mortality and newborn mortality for nations. So they have brought up this data. If you read it, you will be motivated. As to yes, midwifery is this kind of a world. Maternal and child healthcare is this kind of wonderful world for me to work in. You're very hands-on, you're with your heart, you're with wonderful knowledge, okay, and you are making decisions. Okay, right? Yeah. So I agree with you to that. Yes, very curious about something. Our Indian trades and everything. Okay. I think my other friend is waiting and we should heard it. Thank you very much. Thank you,
इस सारे पोजीशन होगी बात टाइम के लिए या और प्रेगनेंसी पीरियड में भी कर सकते हैं
प्रेगनेंसी पीरियड में पेन और खुशी नहीं होगा प्रेगनेंसी पीरियड में हमको स्ट्रेंथ पाने के लिए वो जो दवा और की दवा है उसके लिए तैयार होने के लिए बॉडी को तैयार करना पड़ता है प्रेगनेंसी एक्सरसाइज करनी है या फिर stretching, someone focused on pelvic floor, someone focused on your knees and your muscles of your body. Okay, so those are the first exercises we did actually. When the mama comes for labor, she already taught exercises in the childhood class, especially who is labor के क्या क्या करना है, कैसे करना है. So these are some positions and mobility during labor and other positions for that actual during the are working positions. So position one, okay. If somebody has a gym okay, exercise then we have to go back. Yeah. moral silence. Okay? Yeah, be careful. You should know how to use it. You're welcome. And that's why I encourage you early that you have a feedback or classes on exercises happen like relationships happen that's all available there are possible. Get motivated. Give the actions for everything for that. Yes. Good question, right? These positions they are more helpful positions during the day are to give you different structures, right? So when you allow more according to our basic definition, there is less likely that they will fail. Right? Okay. Even if you have three side apple shape, there is posterior vein, three side apple shape. These are photos and work on vibrations. We try all that. Allow the vein to get space to change the position. If nothing happens, then yes, again there's a 20% chance that the mama may have to go for a C-section or instrumental birth because the baby doesn't do well. We are happy the baby is doing well. We don't have to do much wrong. Mama is exercising, baby is progressing, we are happy to wait. Okay? But the baby starts compromising. Right? Mama is exhausted. Right? And baby is not doing well. We are having issues with baby. We go back. Baby starts getting better. Then you don't really have the chance to move it before escalation and also changes. So monitoring is very important. Keep monitoring. Don't just be happy to have it. It's not a big enough. Be monitoring. Thank you, Stephen. And in combination with speech, so it will be more helpful to make and make more confident and saying okay, there are so many difficulties you will be solved and so many tasks to study so that this program will start as that is not
Yeah, I know. मीडिया ऑन के चलो जाए এটা এটা নেই পিকনিকের এটা ইনসার্ট मीडिया ऑन ইনসার্ট সেম এটা যদি কম্পিউটারে নথিব ডাউনলোড ହେଇକି ଚାଲିବ এই ভিডিওটা ପଠେଇ ଦେଲେ ଆମ ପାଖକୁ ଆମେ ଫୋଲ୍ଡରରେ ରଖିଦବା ଆମେ ତାଙ୍କୁ ଦେଇଦେଲେ ସେୟାର କରିପାରିବେ साइड से
ତା ଫଟୋ ଦିଶିବା ଦରକାର ନା टाइम टेबल स्लाइड कहि जाउछ तमे ଟିକେ रुह बाबा तमे एठी आसी के कहूनो एई पटा ऑन कर ये स्लाइड टा शो करी होनी ना तो अरे बाबा कौन टा करिया चाहते को तुम कर
वीडियोटा प्ले
कहां रे वीडियो स्लाइड शेयर कर छथि
वीडियो ऑन से सबसे फाइलटा पठेई दिले आपको हमें मैडम पठेई से फाइल से जो वीडियो फाइल उडा हम पास पठेले हमें तक कंप्यूटर पे मोबाइल ले पठेई देबे वीडियो उडा
सर अनम्यूट करंतु सर अनम्यूट करंतु ए म्यूट करंतु सर
स्टार्ट करो तो क्लास रो आगे स्लाइड शेयर करें सेपरेटली वी वांट दैट वीडियो
ना मैडम एटा काढी दे टेस्ट करतो ना
एबे एबे काढा नहीं तो सी इज स्टिल गोइंग ऑन टेलिंग whether that is listening when the zoom रे होतला ना नहीं हां कोडी होतला स्क्रीन में तो आसनो दिला छुआ मानकर वीडियो मझिरे मझिरे अपलोड करना मैडम को पोस्ट करो मैडम कौन अच्छे कौन
कौन अछि कौन अछि
ये बीएसएफ
पिन कर दो तांसे बड़ा कर तो पिन कर से तांगा वीडियो टा ऑन करो शेयर करछन सर स्क्रीन आज्ञा सर रेकॉर्डिंग कुछ ना अछि ना ऑनलाइन चल छी सेटा स्क्रीन शेयर करछन ना सेटा ओपन कर आसीबो से ऑन करन तो एटा मैडम ता कोन मैडम स्क्रीन एटा ये तो डबल क्लिक करके ऑन मैडम ओपन करन मैडम ताको डेस्कटॉप शेयर ही आइची से खाली पावर पॉइंट टा ओपन कर
స్లైడ్ కిందకి పైకి పోవడం లేదు కదా. How's that going? Now he's moving. Okay. Shall I start? Okay. Unmute చేసుకోండి. ఎక్కడ అన్మ్యూట్ అనిపించలేదు. అన్మ్యూట్ లేదు. హలో 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 వాళ్ళు అన్మ్యూట్ చేస్తున్నారు.
Hemo ma'am, you can continue ma'am. It's
Can you able to
audible.
hear me?
Yes, yes, it's audible.
Yes. Okay, good afternoon, ma'am. Can I hear me?
Yes, yes.
Okay, thank you. Okay, good afternoon to one and all, especially for SCB college principal, teaching faculty, and my dear friends and students. Good afternoon to one and all. Thank you very much for giving me this opportunity to take as a resource person. Now, today we are going to discuss about this non-pharmacological methods or comfort measures during the labor. Why we have to concentrate this, especially during the labor. Okay, before going to this, we'll have. Hello. Okay, thank you. Okay, good afternoon to one and all, especially the SCB college principal, teaching faculty, my dear friends and students. Good afternoon to one and all. I am Dr. Hemlata, state level midwifery educator from Andhra Pradesh. I am very glad to introduce myself to Odisha state. Really, I am very happy and to share my knowledge to Odisha state people. Thank you for giving me this opportunity. Now, before going to introduce this non-pharmacological comfort measures, especially the labor itself, the most of the mothers or pregnant women, they'll feel very tensed and they're very fearful because my mother has told, my sister has told this is a painful situation and very discomfort like that. Each and every person, they'll have a lot of tension in their minds, especially. That's tensions we are going to relieve as a midwife or a nurse. We should take care of the mother during the labor. Especially the labor, we need is oxytocin hormone. This hormone we have to produce naturally from the mother's body by making our comfort measures. That is our responsibility as a midwife. We have to take care of the family members as well as the mother and even birth companion also. How we are going to fill the labor room with oxytocin? Oxytocin is the called as a labor hormone or loving hormone, and we can call mothering hormone also. Mothering hormone is nothing but like during feeding time or lactating, this oxytocin will be produced. At the same time, even in the labor time, the lot of oxytocin, if the mother produces, the labor will be lesser time and even it will be helpful for the mother to reduce the duration of the labor. Labor room should be filled with oxytocin. How we are going to fill this oxytocin? Whether we are going to buy or purchase it? No. Naturally, we have to produce it from the mother's body. How? Through the providing comfort measures to the mother by talking or by giving a lovable person's birth companion. The mother who is chosen, those persons has to be her birth companion and providing comfort measures. But especially in our government scenarios, we will be stick on the mothers to be on the bed only, continuously in the lithotomy positions, without making the mothers to move around it. At the same time, we are not giving any oral also. That is not a thing. It is not going to produce the lot of oxytocin. This is going to suppress the oxytocin levels. That's why by as a midwife, we have to take a initiation to produce a lot of oxytocin hormone and endorphins by our comfort measures only. Okay, now we will discuss one by one which are the things will be coming under these comfort measures. Especially there are so many techniques or measures are there to reduce the pain and even their fear and their to provide comfort measures. But especially we are going to discuss the 9 aspects of this non-pharmacological comfort measures during the labor. That first is the food and fluids. Next, hot and cold fermentations,
visualization and visual focus. We will discuss each one in depth. Birth affirmations, hydrotherapy and shower, breathing techniques, ambience and aromatherapy, massages, acupressure. Okay, we will let us know each one in detail. Before going to know about these comfort measures, first we will know what is this pain, how it is going to helpful in our mother. By seeing this picture, please don't be panic. I'll explain in a simple language to understand each and every one. Okay, we have a brain, spinal cord and back. Okay, and we have a two pathways, nerve pathways. Nerve fibers will be there to carry the pain to the brain, and at the same time, these pain carrying messengers are the small nerve fibers. Okay, when the mother is having a strong contractions, the small nerve fibers are going to carry this pain message to the brain. At the same time, we have a large nerve fibers also. Okay, these are going to carry faster than the pain. Okay, these larger nerve fibers are going to carry the information from the five senses. Okay, everyone knows about the five senses, but simply we will be debriefing those five senses like smell, taste, vision, hearing, and even touch. Okay, smell means how we are going to provide smell in the labor rooms. Like the mother may like the jasmine smell or some other smells. Those oils can be used to produce or to release. By making these nice fragrance, the nerve fibers, the larger nerve fibers are carrying this information to the brain faster than the small nerve fibers. The small nerve fibers, we have discussed that the small nerve fibers are going to carry the pain information to the brain. But at the same time, we have a one gate in the brain. This gate is going to block this information, because now larger nerve fibers are going to carry this information before the pain message gone to the brain. Okay, by this fragrance, the pain we are not going to reduce it, but here if the message has gone before, now we are making the busy the brain function. Now brain will be making function over this the sensors and the large fibers which has taken from the these five sense organs. Now automatically we can reduce the level of the pain the mother is experiencing. Okay, through this we have some idea about the pain. Next, with this only we can able to discuss this comfort matters, how we are going to helpful to the mother. First one is the food and fluids. How these food and fluids are going to helpful for the mother. But in our government hospitals, we are restricting the mothers not to eat, not to drink, not to move like that. But especially now in the current trends and technology, as a midwives, we should not restrict the mother in the particular position or in the particular place only. Here, as per the WHO has suggested that in the 2018, they have suggested the mother requires the nutrients and the liquids to cope up her body when doing the vigorous activities, and during the labor process she needs more energy to cope up from the pain. That's why they have suggested to encourage the mother to take plenty of oral fluids, at the same time to keep up the mother's energy levels top. And at the same time, fasting in a labor is unpleasant. If you are making mother without any food and fluids, the mother will be very lethargic and she may not cope up with the contractions. She may not able to bear down when the birthing reaching. For women at low risk mothers, especially without any complexities, we can encourage easily digestible food and fluids. Oral fluids like juices, fruit juices, soups, whichever the mother prefers. But we should not advise to take like palaws, biryanis like that, because these masala foods are not going to digest early. We have to give like khichdi, idli, like soft diet can encourage to boost up their energy. Next, hot and cold fermentations. Which of the things comes under hot and cold fermentations? Especially we have a lot of methods to have. For example, if we have a monthly periods time, dysmenorrhea, if you have a lot of pain in the lower abdomen, to get relief from that without any medications, what we can do? We can take a shower or we can use a hot water bag also. If you are placing the where the mother is feeling pain, there if you are placing hot water bag, then we can reduce it pain. But as a midwife, we should follow certain precautions that when you are using hot fermentations, we should be very careful that this hot water bag should be wrapped with a cloth, or maybe we can use a pillowcase wrapping over it, and we have to place where the mother is feeling discomfort, whether it is in the lower back or maybe in the abdomen, we can place it, but it should not be placed it for longer period also. If you place it for longer time, what will happen? There is a chances to get burns or scalds to the mother. That's why as a midwife or a student trainee also, we should be very careful that when you are using hot fermentation bags. Okay. At the same time, we can use a like ice packs also. Ice packs, even we can use the cans which we are using like a Pepsi, Coca-Cola, and those cans tins also we can use it, the mothers regarding the choice. Because some mothers with the warm compressions, the pain is going to reduce. Some others they may feel with the cold fermentations only the pain is going to reduce. Each woman have a individual perceptions. As per the interest and perception of the mother, we are going to provide as per the interest of the mother, whether she need hot fermentation or cold fermentation. At the same time, we can use showers also, we can use it. If it is possible, if we have that facility, we can advise or encourage the mother for the hot showers also. Hot or cold applications, like wherever the mother is complaining that. At the same time, with instead of using hot bag or maybe the ice pack, even we can use it. Each and every home they will have socks. Yes, new one. In that we can fill with the rice, and this can be heated in the 2 to 3 minutes. We can keep it in the micro oven, and those bags can be tightened, and you can apply it wherever the mother is feeling discomfort or maybe pain. This can be place it for few minutes, and then you can be displacing that positions also. These are the tools we can use it to reduce the pain by using these measures. Next, we'll go to visualization and visual focus. Visualization and visual focus means, especially when the mother is in the labor situation, we have to explain the mother that she has to imagine the whichever the scenery or the whichever the situation previously, whether she has been to any tour or maybe visit, or she may like her birth companion or maybe the first child, whichever the she likes more, that she can imagine at the garden whichever she have, or maybe the any flowers bouquets, like that, anything. Ask mother to close her eyes and she can imagine the situation what she is likes more. With that also, she may focus on the positive imaging and with her sight, and this sense also can be carried to the brain, and this can be reduces some extent of the pain in the mother what she is experiencing. Next, we will move to birth affirmations. Birth affirmations is nothing but whichever the labor rooms the mother is placed, surrounding the walls can be placed some pictures like birth affirmations, like quotations we can write it like positive thinking, like my baby will arrive at the perfect time and my body is fearful even though wonderfully it can be made designed to make miracles. Like this, so many positive things can be written in the charts, or it can be designed well and it can be placed where it can be reachable to the mother and she can able to feel that. And with these affirmations, the self-esteem and self-confidence levels can be improved to the mother. and this helps the control over her thoughts and influences the way mother feel very positively. Positive thinking is very important, especially in this labor situation, to reduce the duration of the labor. Next, hydrotherapy. Hydrotherapy and shower. Here again we can take warm and buoyance of a shower or gentle massage by jets of soothe and help body to relax. Suppose example, if you have a lot of back pain, you have did journey and long 2 or 3 hours journey, if you come back and if you take a warm shower, after shower we will feel very relaxed our body and we will be very feel comfort. Same way, when the mother is feeling the contractions, strong contractions or strong waves, if she is getting, she could not able to tolerate that time. We can ask the choice of the mother whether she wanted to take warm shower, whether we will see it. If she is okay, we can encourage the mother to take showers, or otherwise we can take immerse in the tub of water also. As some others, they may not be interested in the warm showers. As some maybe they need without shower they wanted to. Or we can give like warm compressions like a hot water bag or maybe like a warm towels also we can place it where she is feeling discomfort. But before doing any step of this, we should give a preference to the mother's choice. Next, we will go to the other method, that is a hydrotherapy. And these pictures we can see we can make the mother like sitting comfortably, reverse sitting on the chair, and we can maintain this body temperature at the water temperature we can maintain, and take shower for how long she likes. Or we can immerse the mother in the warm water, and we can encourage the birth companion along with the mother, whichever whomever she likes also. Or if you want, the mother wanted only the midwife, we can be with the mother when she prefers. Next, we'll come to the breathing techniques. Especially even in the general patients also we'll encourage to do the breathing techniques. But especially in our labor, these breathing techniques are very useful to the woman to cope up with their pain. What are the benefits with breathing exercises? A lot of breathing exercises are there. But I don't want to confuse with too many breathing exercises, but we will use two, we will discuss in detail. Okay, benefits. Before going to discuss about those types, we will see which are the benefits behind of these breathing techniques. Especially with these breathing techniques, the mother will enhance relaxation, and it reduces the pain, supplying uterine muscles with oxygen. If you take a good deep breathing exercises, will the uterine muscles will get more amount of oxygen, and increases the oxygen supply to the fetus also. And this will help to descent of the fetus as early as possible. It provides focus to stay distracted. The mother, if even example, when we encourage, if you are having too much stress, we will ask them to do meditation or breathing exercises, or maybe you concentrate on your breathing. Yes, no. Same way here, suppose if mother is feeling too much pain, could not able to tolerate, in that time to distract the mother's mind, if you are using these techniques and if you are asking or insisting mother to concentrate on her breathing, we are going to distract the mother from the pain also. Make labor discomfort more manageable. We can manage more easily with the help of these breathing techniques. Okay, in these breathing techniques, first we will discuss about slow breathing or with this distress breathing. Okay, how we are going to slowly breathe this, but we are not concentrating how we are breathing. Automatically, spontaneously, each and every person will be taking. We cannot see that, no? But here we will suggest to use when the mother cannot walk or talk through the contractions. Especially through the contractions time, if you are encourage the mother to do breathing exercises, they will be irritating. Don't talk to me, please go away, like that they'll be rejecting the midwives. Yes, no, but depending upon our talking and communication, how we are going to make the mother to be very approachable and friendly nature, can be used for as long it comfort for the mother. Okay. And by exhaling, focus on relaxing a part of your body. Average 7 to 12 breaths per minute. Okay. Just I'll demonstrate now how we are going to do this slow breathing. This slow breathing can be, we can suggest the mother even in the first and second stage of labor. Okay, slow breathing. Slow breathing means we are going to explain the mother to take deep breath through the, I'll show the picture, through the nose, and slowly we are going to exhale through the mouth. Okay, asking the mother to take deep breath through the nostrils or through the mouth in, and we are going to exhale it out through the mouth. Just I'll demonstrate it. Once again, I'll show you. Take deep breath through the mouth, through the nose. Exhale out through mouth. Okay, because if you are taking this deep breathing exercises, the mother's mouth will get dry and the lips will be getting dry. That's why we have to keep on encouraging the mother to take plenty of orals to avoid dehydration of the mother and to maintain the moistureness and to maintain the hydration. Next type is light breathing. First one we have discussed slow breathing. Okay, here light breathing in the transition period. Transition period is means about to have full dilatation and the baby is going to come out. This time the contractions will be stronger, longer. Yes or no? That's why in this particular period the mother may not be cooperative with us. They may be hyperventilating themselves, but hyperventilation is not correct in this situation. That's why we should slowly we should encourage the mother to take light breathing. What is the difference? I'll tell you now. What is the light breathing and what is the slow breathing? Slow breathing already I've demonstrated to you. Right? We are going to take through the nose, inhaling through the nose, exhaling through mouth. But in the light breathing, the same mechanism, but here we are going to use this when contractions become closer by intense. Okay, when it is getting very stronger and within few seconds again second contractions will be getting. Use this when you lose rhythm. One breath every 1 or 2 seconds. Make small sounds and exhalation. Okay, just I'll show how this light breathing can be. Okay, now we are going to, this is light breathing, not like hyperventilating. Slowly we are going to inhale 2 times and exhaling 2 times out. Okay, once again I'll show you. He, hoo, like that. We are going to take this. This is more helpful, especially in this transition phase. Next, ambience and aroma. Okay, most of our government setup, we may not have good ambience and good fragrance of smell. Yes, is it correct or not? Yes, because of our lack of resources, maybe our lack of privacy facilities and the infrastructure facilities. These are the our Indian government scenario settings labor rooms. But within that also, with limited resources, we can make a good ambience and aroma in our labor rooms also. Make environment quieter, calmer and gentler. Yes, no? But especially in the labor rooms, our healthcare professionals will be making too much of noise. Will be getting resound also. That should not be done, especially in the labor rooms. You should be calm, quiet, and gentle. In the beginning, when I've discussed that oxytocin, the room should be filled with oxytocin, I said no. Here, with this environment, with a good, quiet, calm, gentle environment, this room is going to fill with the oxytocin. Okay, next, feel free to use change of lighting, music, and fragrances to help keep mother calm and the progress of labor. Okay, for example, for this lighting, I'll tell you one example. Nighttime, we are sleeping at home. If we have a light, we may not get sleep as early as possible. We will make the light, our bed lights to be dim. The same way, here, we are not going to make the mother to sleep, but with the focus lights, it may be not helpful for the mother. It is disturbing to the mother. To make this environment favorable to the mother, we should make dim lights, calm environment, and the fragrance of the smell. This will be helpful for the progress of labor. The fragrances also, we should ask the choice of the mother. Some mothers, they may not like some flowers or some smells. Is it? That's why we should ask the preference of the mother, whether she likes jasmine or lavender like that. And as per her wish, we are going to use this or promote this relaxation and the progress. We can use the condensers. Suppose in our setup we don't have any condensers or to get these fumes. Yes or no? Our fragrance of lamps also we are getting. That also, if it's not available in our facility, we can take like jasmine oil or lavender oil. We can dump in the one wet towel and we can place over her forehead, or maybe we can keep next to her. With the smell also, we are going to provide the nice fragrance to her, and this smell it is going carrying to the brain, and this will be subsiding the contraction, sorry, that pain sensation to the mother, and the mother feels very relaxed, especially more relaxation when she is doing this like breathing techniques. Along with this ambience and aroma, we can have music therapy also. Some mothers, they like light music or some instrumental music, or maybe some god's music, like that, whichever she likes, we can place it in the background music. This will be more helpful, and this can be encourage the mother to have a more relaxation in her mind. And even healthy pregnant women can request pain relief during also, but especially we should, as a midwife, we should try to, without any pharmacological methods, non-pharmacologically, we are going to try to reduce this pain of mother during the labor. Next one is, see, like this we can arrange our labor rooms like a ambience, how dim light we should place it, the setup. This should be very nice. Suppose if you are going to sleep before going to get to bed, if your bed is full of clothes or something dirty, whether we feel like to sleep? No. Our labor rooms also should be, it should be very ambience to have that feel. The mother, if she feels that, automatically lot of oxytocin and endorphins can be produced from her body. Okay, and the ambience, you can use the whichever she likes, that oils if you put, automatically the nice fragrance smells will come, and this will be helpful for the mother. Okay, massages. Next step is massages. What are the benefits with this massage? We have a lot of techniques in this massages. Everyone would have felt any one time from childhood onwards. Is it not? Suppose if you are in the childhood, if you are having a lot of headache, you request your mother, Ma, I have so much headache, please do something. What our mother will do, she will take some warm oil and she will be doing massage. With this massage, sometimes the kid may get sleep also. Is it? The same way here, the mother, she needs some support, and her body has to produce lot of endorphins. Now everyone may be knowing about endorphins. No, endorphins is really the helpful natural hormone, and naturally it is going to reduce the pain. Okay, we are going to produce lot of endorphins by doing the massages. Is it? That's why, what are the benefits with this? Here, especially it directs the attention away from the labor discomfort. By doing this massage, we are going to divert the mother's mind from the pain situation or from the discomfort. And we should encourage the mother and support and reassurance and love. Understand? Here, suppose in the labor room, but in our AP, they are not allowing the birth partner along with the mother because they are men. Is it? That's a main thing. But in some corporate hospitals, they are allowing. Suppose if she wanted her husband, if you are allowing her partner or birth companion as a birth companion, we are going to, by doing this massages, instead of giving by midwife, if her husband is doing the massage, a lot of oxytocin. Already I said no, it is a love hormone or labor hormone. Is it? The thing, it is going to produce a lot of hormone like oxytocin, and naturally the labor process is going to be shortened. Is it? Next, effective pain coping measures during contractions. I can give one example. When I was taking training in Fernandez, Hyderabad, I have one mother. She is a primary mother. She is having around 4 to 5 centimeters dilatation. She is screaming like anything in the intrapartum room. What she is telling, no, I cannot tolerate this pain. Please take me to the cesarean section. All the doctors, everyone, all the midwives, everyone, they were explained and tried her, but she is not listening to anyone. No, I could not able to tolerate this pain. She is insisting her birth partner to take to the cesarean section. That mother, I got it, and just I explained her. Her name is like I'll change and tell the name. Sonia. Okay, Sonia. Just on 10 minutes time you give to me, I'll give certain massage techniques. In spite of doing these massage techniques, also if you are not getting relieved from the pain, then we will take to you for the cesarean section. Okay. First she rejected, and then again I tried to convince to the husband also. Now he also started convincing her. Finally, with this motivation, she accepted that. Now 10 to 15 minutes, whenever during contractions, I used to do back massage and counter pressures to the back where she is complaining. I have lot of back pain. I cannot able to sit like this. I cannot able to lie down like that. She is doing. Then I started, whenever she is getting pain, I started doing massage. Then after 15 minutes, she felt very happy that, and whenever she is getting pain, oh, sister, please help me do massage like that. She is requesting me to continue that. With this, 1.5 hours over. I told you 4 to 5 centimeters dilatation. No? Within the 2 to 3 hours, she got 8 to 10 centimeters dilatation, and she had a normal vaginal birth. And after that, still she is in the touch with me, but she is from Telangana. I am from AP. Still she used to call me that, sister, you have helped me that to have a normal vaginal birth. Otherwise, I would have been posted for cesarean section like that. That is everything. It is depends upon our patience and how we are going to convince the mother to accept our explanation. Okay, and certain manual techniques such as massages or applications like warm packs also we can do, and we can whichever the feasible or whichever the preferences of the mother's choice, we can advise, and we can give a fomentations also along with the massage. This also the WHO has been recommended for this. Okay, in these massages, what are the do's? Why? What are things to be done before doing massage? Always ask for permission before touching her. Without mother's consent or without mother's permission, we cannot or we should not touch the mother's body. Is it? Yes, we should take prior permission. Always let her know beforehand which part of her body you are going to touch. You have taken permission for touching, but which part you are going to touch, you should tell her no. You have taken permission. Suppose if you are going to touch and her back, she may feel bad for that. Some women, they may not like to touch somebody, no one. Yes or no? That's why we should be very careful that we should not, without permission, we should not touch. And after taking permission, we should take permission which part you are going to touch or which part you are going to massage it. Always take feedback while doing massage. Okay. Suppose massages most probably we are going to do in during the labor process or during the contractions. Is it? Now during contractions, the contraction has stayed for 40 seconds. We have massage, back massage for 40 seconds. After, in between the contractions, again we should ask the feedback whether you are feeling comfort with this measure. No, I am not feeling comfort, sister. Please change this massage. Then we can go for another technique also. We have a lot of techniques in this. Okay, otherwise, no, second time also we will try. No, whether you are comfort with this measure. Yes, I am comfort. Then we can continue those techniques. Is it? Okay. Next, in this, how it is, this massage techniques are going to helpful for us. Relieving back pain. Okay, to relieve most of the mothers, because we will have lordosis, because of the tummy will come front automatically, this lumbar curvature will be more, and when she is taking rest also, this lumbar region is not going to touch on the bed or maybe the floor. Automatically, most of the mothers will be complaining the lower back pain. To reduce that pain, we are going to use these techniques. Like we have counter pressure, we have double hip squeeze, knee press, rolling pressure, light touch massage, like that. I'll tell you one by one. In this light touch technique, massage counter pressure. Okay, counter pressure, I'll demonstrate to you also. First, we will discuss how it is going to helpful for us. Throughout the contraction, use closed fist of the both the hands to steadily press on lower back. Okay, I'll demonstrate and I'll explain to you. And double hip squeeze also is a massage knee, massage rolling, light touch massage. Okay. Just first see the video, then I'll explain one by one. This is one type of counter pressure. Okay. This counter pressure, now she is thinking that she is having pain in the lower back. Now she is asking to give massage over there. Then we can take the both the hands and the base of the two hands and placing over the where she is complaining the pain. When we have to give the firm pressure, and we should not shake like this. We should not shake the body. Okay, we should give firm, moderate pressure to the mother. And when we are giving this pressure, we should ask the mother that whether she is having some relief or not. Okay, if you are shaking, this will be discomfort. We are, instead of helping the mother, we are going to disturb the mother. Is it? It should be helpful to the mother. Once again, I'll show you this video. Firm pressure. Firm, moderate pressure should be given, whichever the part mother is feeling that discomfort. Okay, in the massage, we have lot of techniques. One by one, we will show now. See, this jerky movement should not be given to the mother. The firm, the hand should be in the perpendicular shape and it should be moderate pressure. In this massages only, now I told you the starting base of the palms. Now palm over the palm and the back. where the mother feels discomfort or pain, there we can give like a counter pressure. And the hand should be perpendicular and it should be moderate. Firm pressure should be given. There is no jerky movements. No jerky movements. In this massages only with the fist of the hand. Okay, how we are going to make the fist? We should, this thumb is there, no? Thumb should be closed inside, and where the mother feels pain, there we should place our two hands perpendicularly, and we are going to give throughout the contraction this pressure. In these counter pressures, we have like with the three techniques are there. So many are there. Mainly we are going to use the base of the palm. We are going to use the two places where the mother feels discomfort, and throughout the contractions we are going to give this counter pressure with the base of the palm. Another thing is we can place palm over the palm and with the support of one base of the hand, and we are going to give continuous pressure. Next one is the with the fist of the hand, and we are going to give the pressure like how we have shown in the video. Another one is a hip, double hip squeezing. This is really more helpful during the labor, especially when the baby head is going to come out. Okay, how it is going to helpful. Okay, now the mother is like all fours or maybe sitting reverse on the chair. Okay, if you are sitting like this, our outlet diameter will be narrow. Suppose if she is sitting reversely, automatically the outlet diameter will be increasing more. Here, now we made the mother to be sat on the reverse, sitting reverse on the chair. Automatically, the diameter is going to increase. See, when we are pressing, hip squeezing, automatically this outlet diameter is going to increase it. Okay, now we'll see this video how it is going to be. Okay, with the help of this, with the double hip squeeze, the outlet diameter is going to be increased. Okay. Once again, you can see this double hip squeeze. Till the completion of the contractions, this double hip squeeze to be continuously give a firm pressure. And we can ask the mother whether she feels comfort or not. If suppose if the mother she is not comfort with this technique, we can skip to this other technique. Next, light massage. How this light massage is going to helpful? Already we have discussed that oxytocin, endorphins like that. This endorphins. Endorphins is a natural pain relief measures. These hormones, lot of endorphins. Endorphins, how it is going to be produced by ourselves. Suppose if you are on the bare skin, if you are touching, automatically this will be stimulate the endorphin hormones. Like how we can able to evaluate whether endorphins are produced or not. In our skin, the goosebumps will come up. Okay, goosebumps will come up. That means lot of endorphins has been produced. Okay, with this light massage, more effective and doing on the bare skin. Suppose if the mother is comfort with the bare skin, we can do it. No, some mothers they feel no, I don't want to expose myself. In those mothers, even with the and the close also we can do it. Okay, we will see this how we are going to do this light massage. From the bottom to top, top to bottom. Okay, and we can be able to do till mothers feels very comfort. And another thing is rolling technique or rolling massage. Okay, we have a very less resources in the labor room, or tools, birthing tools are very less in our government scenario, that we can see that with the improvisations we have a lot of water bottles, everything, no, with that also we can do this rolling massage or rolling technique. With this also we can produce a lot of endorphins, and the mothers will get relief from the lower back pain. With the water bottle we can roll over the back where she is complaining pain, and upper shoulders also, till upper shoulders it can go and again come down and go up. And even market we will be getting lot of like rolling tools are there. If you are affordable we can purchase that, and even we can use those rolling things. And in between, suppose the mother is feeling very discomfort during contractions, we can do this rolling technique, and in between the contractions we can use like this hot water bags we can use, as suppose the mother want only the cold water compressions, and you can use cold water bags also, we can use it. And one more thing is knee pressing. Okay, this knee pressing, how it is going to be helpful, especially if you are doing a correct technique, the mother will feel the pressure over the back. Suppose if you are not doing correct technique, the pressure in the pubic area. That you should remember that how we have to do this technique. Mother has to be placed in a comfortable sitting position, and the thighs should be parallel to the floor. Parallel to the floor means, now without, see, bottom of the mother's legs we have put 2 yoga mats to paralyze her thighs to the floor. If you are not paralyze the thighs, and the technique what we are giving this knee pressing, it will not be effective to the mother, and the purpose is not going to serve it. Okay, just we will see this video. And we have a lot of gravity maintenance positions, especially we should provide gravity. Why gravity is very important, but in our most of the government hospitals we are not thinking about this gravity, is it? Gravity is nothing but, now suppose if you take one pillow, we have to put the pillow cover, off of the pillow we are going to put the cover, and then what we'll do, we'll be doing juggling. The pillow will go inside. The same manner, suppose if you put it on the bed and if you place it, whether it will go inside? No. If you lift it up only, the maintenance of gravity, the pillow will go inside the pillow cover. Is it? Now the baby is in the tummy, the baby has to come out. Suppose if the mother is in the lithotomy position lying down, the baby has to come out against the gravity. With that, it is taking too much time to have normal birthing process. To avoid or to reduce the duration, as a midwife we are going to use this gravity and comfort measures. Whichever comfort measures are there, any measures we can use these techniques. Simply I am going to debrief these massages. Hip squeezing, counter pressure, where the mother feels discomfort, the lower back. Next, palm over the palm. Any sitting position or maybe lying down or maybe in the standing position, whichever the position, these massages or these techniques can be used to get relief from this discomfort. Okay, next last thing is, and before this we will see these benefits of these techniques. Each technique, what are the benefits? In light touch massage, throughout the contractions we are going to use it. Firm pressure will be there. In various positions we can do it. And much pressure has to be applied. Not too much pressure, not too slight pressure also. It will not be effective. Moderate pressure has to be applied. Exactly which spot the mother need comfort. Those area we have to select it. Next, double hip squeeze. We did know double hip squeeze. Both the bumps we are going to bring together during the contractions. Okay, during the contractions, stay close behind her. We should, as a birth partner or a midwife, we should close near, kneeling down in front of her and back and going to press it. And apply steady pressure throughout the contractions. We should not do the jerky movements and we should not release it in between the contractions. Okay, next, massage knee. Align thighs parallel to floor. Already I have explained, we have put 1 or 2 yoga mats to keep the thighs parallel. Then only it will be effective. The pressure straight back towards her hip, it is going to be helpful. Rolling pressure. I have told you we can use different water bottles or maybe we can take the birthing tools also. Move rolling where the mother feels pain around the back or in the shoulders or maybe in the sides of the abdomen, anywhere we can use it. Light touch massage, like feather touch we can say. And it helps to produce lot of endorphins. Endorphins is nothing but the natural hormone to reduce the pain without any medications. Okay, we'll get next. Last one is acupressure. Okay, last technique is acupressure. Okay, discuss about this acupressure, especially in the antenatal period itself. But we should not do in the antenatal or prenatal period. But the mother should be aware of what is this acupressure, how it is going to be helpful. Because suppose the mother is in the labor during the contractions, she will not listen to what we are going to explain to her. Is it? With a painful situation, if you are explaining acupressure means this, how it is going to helpful, whether she is going to concentrate on you? No. That's why we should prepare mentally the mother in the prenatal visits itself. When the mother comes to you in the midwife OPD, we should explain what is important. But we should not do in the antenatal period. But mother has to be aware of this acupressure. Okay. Next, when the mother has admitted for the labor, we should mark the points before the hand. Before the hand means when before shifting into the labor room, in the intrapartum waiting room itself, we should make the points where has to be given, what type of pressure has to be given. Okay, first we will see the cuckoo point, where it has to be given, how it is going to helpful. Makes labor contractions more effective. Aids body's efforts to help in fetal descent. Suppose the mother had fully dilated, but the fetal head is not coming down. To make faster, with this help of this cuckoo point pressure, the baby head is going to come down very fast. Okay, will head fast. If a mother is exhausted and not able to push effectively, suppose fully dilated, the head has been stuck here, not able to cope up the mother with the pains, In that time also this Huku point will be going to helpful, and even pain relief also will be better. I'll show how it is going to be. Okay, we'll take our hand like this, and the thumb finger and index finger, we have web space. Web space is there, and the junction of the index and the thumb finger, we are going to make the point. This red point is there now. There we are going to press it. Gentle pressing till the contractions disappears. Again, if there is no contraction, release it. Again, when contraction starts, again press it over. But each acupressure or even massage techniques, after each technique, we should ask the feedback of the mother. We have discussed already in the dose whether it is going to get relief from the pain or not. Is it? That we should not forget as a midwife, before we should do it, and we should ask the mother after this step whether you have got some discomfort or there is no discomfort from this position or this technique. If suppose mother says, I am very comfort with this, and we can continue further also. No, I am not comfort with this, we will shift to another acupressure point. Okay. Next is a SP6 or spleen 6 also we can say. This is also very good for, especially this will be helpful for effective to dilate cervix. If the mothers, in spite of doing different birthing positions, now what Sheetal has discussed, different birthing positions and different exercises, different techniques, even though the mother is not getting progress properly. Yes, as per WHO, per hour at least 1 centimeter has to come for the primary mothers. Even though it is not getting, this technique will be very helpful for us to get cervical dilatation. Helps with after pains while breastfeeding. Okay, everyone may be knowing about after pains, especially multi mothers. They'll after feeding, they'll be having lot of discomfort in the lower abdomen, and they'll be feeling that the uterus is getting pinching like that. In that type also this acupressure SP6 will be more useful. It helps baby to rotate from the OP to OA. More helpful. OP means occipital-posterior. How to identify this position? Okay. How we are going to identify? We'll place the inner aspect. Middle, malleolus. Place the 4 fingers. On top of that, we should make the mark, this red mark, not top of the bone. Back side of the bone, we should mark it, and there we are going to press it. Where the point spleen 6 is there, no? There we are going to press it during the contraction. If contraction disappears, we should stop it. Then again, during contraction, we should start. Okay. Next one is the point acupressure BL60. BL is nothing but bladder. Bladder 60. Takes mainly efforts to help in the fetal descent and helps baby to rotate if OP. Occipital-posterior to OA rotation, it will be useful, and even for fetal descent also. This is lateral aspect of the malleolus. Just behind the malleolus, and take point and press it. Both the legs at a time we can press it. If mother is in the standing position, we can lean down on back side of the mother and we can press it both the legs at a time. Suppose mother is in the left lateral position, both legs at a time we cannot do it. Is it? We can do it one leg, and after 5 to 10 minutes we can shift to the another leg also. Next, last one is a acupressure BL67. Okay, bladder 67. This is also helps baby rotate if OP to OA. Okay, this is the where our little tiny toe is there now. There we have to make a point where the junction of the nail joints. There we make it, and the 2 little toes we are going to press it 1, 2, 3, 4. 4 seconds. Then release it. Then again 1, 2, 3, 4. Press and release it. Okay. These are the pressures. Once I'll show the video. Place 4 fingers, not on the board, back side of the board, and press it. Outer aspect of the malleolus, just behind that malleolus. We can press it, both the legs together. This already hook point we said, no? This junction of the web spaces. The index and thumb finger, we are going to press it. These points should be placed before itself. Okay. Have anyone have any doubts regarding this? This is peak period, lunch period. Is it? Any doubts in these uncomfortable measures, pharmacological measures? Is it useful to you?
Thank you, ma'am. You have been accepted our invitation and joined to the online. Actually, it's been difficult for us to make it. And you have actually given. Really, the information whatever you have given now, it's skillful and everything. It should be in the hand of the students, in the hand of the midwifery, and the talk whatever you have given now and deliberated. Really, it's informative and interesting. So thanks a lot, ma'am. Actually, that information is very valuable for the students, for the midwifery who are every day going clinical and doing the practice. So, present, have a big, loud approach to ma'am, and with that, we'll, with this, now we are in the end of the scientific session. So, already 2 days gone, and thanks a lot to all resource person because for their cooperation, for their collaboration, we are in this situation now. So, this is the time for the valedictory session. So first of all, I would like to invite our professional guest, Mrs. Sital Samson ma'am. Okay. So now I would like to request our principal ma'am, SCP College of Nursing ma'am, to be in the dais for the valedictory session to share her thoughts and ideas regarding the seminar. Ma'am, please.
Okay, thank you all the guests, all the dignitaries and all the resource person and all the participants. Actually, this we gained a lot of new things, means our students and all the participants who have joined in online course. They might be gain so many new things which we have not practiced yet. We have seen in labor room how our practice is going on, because mainly we are depending upon pharmacological therapy, whatever, however we are interested for the delivery of a baby, that's all. But we are not thinking about the mother, we are not thinking about the mother's health, anything, properly, as we have to think. So nicely today we learned regarding 2 sessions over regarding how the delivery we will conduct in non-pharmacological therapy also, and in morning also during internatal period, how we have to do the delivery in different alternative bathing position. Nicely we have observed. I think it will be helpful for all the nurses and midwiferys. So thank you all for joining this session. And can anybody in the online mode also, they can share their valuable thoughts, means regarding this seminar and all. So it is already late, I think, because today 2 big session we have conducted that are already late. So we will summarize whatever the things today are in 2 days we have completed. That might be carried out by one of our faculties. He will read the report of 2 days, and then after that the participant, they can give their feedback through online mode also or offline mode also. We will turn the camera and they will give their feedback. Okay.
Okay. Thank you.
Thank you a lot, ma'am.
Okay, thank you so much, ma'am.
Yes. Actually, the information, what we look for that, it's in the way to success. So this is the time for the report presentation. I would like to request Sasita Bhai ma'am, tutor SCP College of Nursing, to present the report. Please.
Good afternoon to everyone present over here. I, Sasmita Padi, on behalf of SCP College of Nursing, going to present today's national level seminar report on theme positive childbirth experience of motherhood on evidence-based practice. On the first day, inaugural session was started with welcome address by Mrs. Vijayalatha, Madam Principal College of Nursing, SCP Quarter, with lamp lighting and prayer. After that, program was started with introductory speech by guest of honor, CDMO sir, Dr. Satyavrata Chhatray. Sir had explained various aspects of positive attitude towards nursing profession. Then program was continued with speech by Chief Speaker Dr. Sudhanshu Shekhar Mishra sir, Superintendent SCP Quarter. Sir had explained regarding how detect the complications of the antenatal mother and early detection of abnormality and timely referral. Then speech is continued by Chief Guest Dr. Ramchandra Rao, Director of Nursing. Sir encouraged us to deliver our best in the clinical field. Then vote of thanks given by Sasmita Naik Madam, Tutor College of Nursing, SCP Quarter, and program was continued by our resource persons. First topic was concept of childbirth experience on evidence-based practice by Mrs. Vijayalatha ma'am, Principal College of Nursing, SCP Quarter. Ma'am had discussed about concept, definition of WHO, about positive childbirth experiences, and what are the evidences on practice regarding it. Second topic was intraprenatal care or antepartum care for a positive childbirth, elaborated by Mrs. Sanjukta Sabat ma'am, midwifery educator SMDI. Ma'am explained excellently regarding antepartum care and non-respectable care with role play. It was very informative and motivating. Then first day session was concluded by program of organizers Vidyanathan, tutor SCP College of Nursing, SCP Quarter. Then second day program was started by Hospital Zilama, educator SMTI, moderator, and program was continued by our first resource person, Mrs. Sital
Samson ma'am, National Midwifery Educator. Ma'am is very energetic. She explained about positive birth experiences, quality of care for a woman with respect and dignity. She has discussed pain relief devices with role play. Then program was continued by our second research person, Dr. Hemalata ma'am, who was a state level midwifery educator. Ma'am had explained about non-pharmacological control measures during labor excellently. Thanking you all. This is all about today's program, today's report. Thank you.
Thank you, Sasmita ma'am. And this is the time to present a vote of thanks to all dignitaries on and off the dais, all faculties, all students, all participants, and all delegates. So I would like to request Sasmita Nayak, SCB College of Nursing tutor, ma'am, to present the vote of thanks. Ma'am, please.
Good afternoon, everyone. Respected dignitaries, invitees, participants, faculties, and dear students. I'm feeling honored to get this opportunity to conclude the national level of seminar on childbirth experience of motherhood and evidence-based practice. Certainly, these 2 days were very useful and we all got opportunity to make ourselves with challenges and developments in the fields of midwifery practices. But organizing a seminar inherent is a task. This cannot be possible without a great wise working hands. Somewhere strong every corner and blessings. Now it is time to convey our gratitude to all who have extended their support to make this 2 days program successful. At the outset, on the behalf of SCB College of Nursing, I profound gratitude to our chief guest, respected nursing director Dr. Ramachandra Rao, who spared time from his busy schedule to grace the occasions. Sir, you were a thank you. I would like to thank our deep, sincere obligation to our chief speaker, also Superintendent is for the active guidance and support. On behalf of my sincere thanks goes to our guest of honor, Dr. Satyavrat Chutrai, CDM PHO Qatar, who truly amplified the seminars. So we received a lot of information and ideas from you, which will surely help us in our professional lives. Thank you, sir. I am honored to be thankful to our professional guest. Tremendous reviews. Thank you, madam. My heartfelt gratitude to our special guest, Mrs. Mehra, Superintendent, who happily joined us to motivate us. Let me express my deep gratitude to our chairs of organizing committee, Mrs. Smita, educator, which motivated us to best. Now, I want to extend my heartfelt gratitude to all the resource persons with their important and views, ideas, and in-depth knowledges. I appreciate their efforts making this seminar. I must mention our deep sense of appreciation for Mrs. Principal concept of childbirth experience and evidence-based practice. Thank you, madam. We are really impressed. I will express our sincere thanks to Ms. Samyukta Sakhi, educator of the IT, Ethnic College of Nursing, for giving excellent coverage to the topic and experiences. We are inspired with your activities and works. Thank you, madam. And to Madam Smita Panchasri and Mamta Jina, Madam. I am very pleased to say thanks to Mr. Siddhar Saxon, National Midwifery Educator for great and elaboration on interpreting the childbirth experience, including alternative research and movements. Thanks for me, encourage us to be more and more skillful and efficient. Thank you, madam. I am deeply gratified to handle the state level educator by the part and the brothers who support us with her substantial and distinguished knowledge on non-family political issues during labor. And I am sure this will suffuse our practices sufficiently. Thank you, madam. I mentioned earlier that events like this cannot happen overnight. The bill started moving days ago. It requires planning and work study to detail. We have been fortunate enough to be backed by a team of very proactive and dedicated staff. I am in short of words, their involvement and their willingness to take on the completion of tasks beyond their jobs. My sincere thanks to our faculty, participants, APM teachers and trainees, and our students. Thank you. My heartfelt gratitude to Mrs. Kirti Rao, tutor, and Mrs. Rasmita Jena, midwifery educator, who moderated the page seminar very smoothly. I thank Mrs. Rasmita teacher, presented the report very beautifully. Thank you. My hearty gratitude goes to the different committees who worked together to make this seminar a successful one. I must not forget to thank Mrs. Sanaradi Nath, teacher, SDB College of Nursing, our organizing secretary, for her selfless effort, though she was not well during the preparatory stage. Thank you, madam. But last but not the least, a big thanks to the computer operators, supporting staffs. Thank you, Mr. Naresh Das, computer operator, Sam Shulin. Thank you, Manoj, Catherine, and Raju. Thank you all. Without your support, it would not be possible. In the big list of thanks given, how can I forget to mention lovely students, our lovely students who worked dedicatedly side by side with us to make this event successful. Thank you, Abhijit, Anirudh, Jagadipan, Vishwajit, Vinny, Vatsal, Vijay, Srapoli, Rasmuti, Smarnika, Charani, and Victor. Thank you, Nirotama, for your beautiful welcome. Thanks a lot to teachers. I request to give them a big round of applause. Dedicated friends. Thank you all, the audiences, for coming here and watching virtually with us. Thanks for your presence and cooperation. At the end, I sincerely apologize to those directly or indirectly helped us, and I forget ongoing to take their names. Hope we all will meet in our next event soon. Thank you. Have a great day.
Thank you, ma'am, for your nice vote of thanks to us. So actually, we are in the end of this session, but I want to say something for this seminar.
First, I would like to thank all 40 students because for their active participation, we made this program success. Especially, I don't know everyone's name, this is my fault, but still, I want to thank special thanks to Abhijit, Aniruddha, Rukmini, Pooja Priyadashini, Sravani, Tanusri, and all the volunteers for this session. Special thanks to Niladama Murmu, third year BSc Nursing students for her welcome dance to make this program success. Once I told to students that we'll organize one of the seminar, so without hesitation, without any delay, all the students they came forward and they cooperated us made this program success. So every cloud of applause to them. As we are lagging in something that I don't want to disclose here, but still by the effort, by their own interest, we are in this position now. So I really salute all the students for their nice arrangement in every step of this program. So really, from the core of my heart, I really thanks to everyone, thanks to all students. Special thanks to Sunil, Varsha, and to Narista sir, computer operator. Without them, we couldn't be able to get success through the online mode. We don't have any setup for that, but still with their arrangement only, we are able to conclude this program, and we are in the end of this session. So that is a great achievement for us. I congratulate all the participants for their active participation for making this program success. So once again, thank you all. Have a great day for you. And with this, I would now like to conclude this program. So thank you all. Thank you. One request to all, feedback link is available in that Zoom link. So please fill up the feedback form and get the necessary certificates. And have any trouble or any problem related to this, please just inform to us. Thank you all.